Environment NCPD is a semi-autonomous national agency under the State Department of Planning and the National Treasury. This institution that's mandated to advise and coordinate issues of population and development in the country. And the role of this institution is to research, analyze population programs, and again advise the government on those findings. We are supposed to advocate and inform the public on issues of population programming, and at the same time also do coordination and implementation of population program across the country.
The concept of PHE integration approach model is not a new one, as it originated from the 1992 Rio Summit Declaration on Environment and Development, UNICED. The Earth Summit. The conference identified the synergy between population, health, and environment as crucial building blocks for achieving sustainable development.
PHE as an integrated approach started as a result of an assessment that was carried out in Kenya, Uganda, Tanzania and Rwanda. And this was an initiative of the Population Reference Bureau of USA. And after this assessment was done, we had the first ever international conference on population health and environment integrated approaches in Addis Ababa, Ethiopia. That was November 2007.
PHE is integration of health, environment, and the people livelihood and the existence. So this is a sustainable, is a developmental matter, and the National Council for Population and Development has taken this matter and is coordinating these activities in certain areas in the country, especially in the lake regions, in the coastal regions, and in some part in Rift Valley.
Population Health and Environment Program is one of the sustainable approaches to development that Kenya has adopted. Kenya adopted this approach way back in 2007, and since then we've been able to roll out PHE projects in the country, and the areas where we've really succeeded in PHE are in Homa Bay, in Kilifi County, and also in Nakuru County.
In Kenya, recognition and adoption of the PHE integrated approaches model came into the limelight during the International Conference on Population, Health and Environment held in Addis Ababa, Ethiopia in November 2007. Prior to this conference, Kenya had conducted the PHE assessment, whose report showed that although some PHE integrated projects had the three aspects of PHE, others were either implementing two aspects or just one.
Basically, Kuresoi benefited from one of the programs that was run by Aviausas called PHE, and in our sub-county it was covering 3 wards, that is Keringet where we are, Amalo, and then Dineta. So in all these programs actually it was done across the 3 wards, and actually concerning the same, our sub-county benefited a lot. In our sub-county we have got 29 community health units, and in these community health units we have got 241 community health volunteers. These community health volunteers, they were trained by Afya Usase in all the health indicators within the community.
And why Kuresoi North and South were chosen is because over the years two sub-counties were lagging behind in health indicators in the county. So most of the time, they used to be reprimanded that they were at the bottom, all the time when they report to the county health management team. And it was, FHI came in to help them try to improve the population health indicators.
Mimi kabla PHE kuja, tulikuwa tunaishi maisha mbaya. Hatuko tunajua utaweza enda toilet, unawe mkono ukitoka. wakakuja wakatufunza, ukienda toilet, hata kama nyumbani ni safi ndani ya nyumba na umetoka toilet ni chafu sana, so inabidi uoshe mkono, usichukue uchafu kwa nyumba. Tukafunza, hatuko tunajuaga. In fact toilet yenye nilikuwa natumia ilikuwa ambao, so ilikuwa chafu. Ndio penye walitufunza nikakuja nikajenga hii. Nilikuwa natumia ingine iko mahali hapo hivi.
This project came to Kuresoi South in Nakuru County because within Nakuru County, this is the sub-county, Kuresoi South, that had poor indicators in terms of maternal health, child health, maternal mortality. We had more incidents of women dying and they could not access services at the healthcare system. And in
Nakuru, you find the Molo area, the approach is mainly towards conservation of the forest there. So as the communities conserve the forest there, which helps them in terms of firewood and also other livelihoods, now they also have other activities which they now come and do within their community and in the household to promote their health.
Communities are being sensitized, trained, equipped, and empowered to ensure that they can have a livelihood from the water, but at the same time also protecting and conserving the environment that they coexist with.
Kwa sababu hii elimu tulipata imetupa manufaa mengi sana. Hata wasichana ambao pengine walikuwa wanahitaji zile mimba za mapema, anaelezea msichana mwenzake, elimu ni bora zaidi kuliko kupata mimba ya mapema. Kwa sababu tukisema hii elimu ndio ufunguo wa maisha, lakini tukisema tunajiweka katika ngono za mapema alafu na mambo na mihadarati, hiyo haituletei faida kwetu.
Wakati wa pusi huwa baharini hakuna samaki. Sasa imetubidi sisi wanaofundishwa PHE tujikimu kimaisha, hali ya kuwa huko juu kama chini hakuna samaki, huko juu tunapata mapeni ya kupeleka watoto shule, wanapata lishe bora ambao sasa kutusaidia hatutakuwa na ile hali ngumu ya kimaisha.
It is important to note that changes in population and the environment is critical in determining the health of the people in a given area.
The National Council for Population and Development is working very closely with this community on issues of population health and environment. Here, from the environment here, you can see the mangroves are well kept, that you can see the people have sustained or have taken care of the environment, that they don't pollute the environment, and they are trained on issues of how they can have a child spacing or family planning so that at least the families have a quality life and quality health.
In areas where pregnancies among women occur too early, too late, or too frequently, more often women also experience frequent illness during pregnancy and complications at the time of birth.
Under PHE we have now, we are having the youth section. So wherever they have their representative who usually come and report. Whenever we have all of them, they also talk, and mainly we find the importance of family planning, and even sometimes we can even incorporate family planning with the kind of plans that we have.
Population health and environment PHE is a development approach which recognizes the interconnectedness between the people's livelihoods, their health, and the environment in which they depend. And now when I take, if I now unpack the P, which is the population, we are now targeting family planning. And in family planning, we deliver information and services to the community so that they can have healthy timing and child spacing, so that the fish in the lake can, the fish in the lake which is reserved can be utilized by the children, our children, for now and even for in future.
Through BMU and the government, we can see a way of educating our people on the correct spacing, so that they see how they plan well on when to have the firstborn, like that. And that if we can manage on that, it means we can suppress the population and we can go on well.
Areas experiencing high fertility, high population densities, poor sanitation, high levels of poverty have highest numbers of people who are unable to meet their dietary needs and food preferences for an active and healthy life. Quite often, these conditions increase incidences of diseases among households and communities in general.
We're just visiting the garden And we're just trying to see how the PHE program is doing here in your household. And it's very impressive to see, that it's a concept that is well integrated, that you have a small-scale farming system around, you have a GECO that's energy saving, and you have a dish rack to make sure that you see your dish after they're washed, they are clean and they're safe for use, and then also the eco-friendly toilet.
The model household means that I must have 8 components, such as toilet, kitchen garden, leaky tin, wire line, dish rack, bathroom, and I must have fresh water for drinking.
Demand for water, forests and land mounts and pressure on finite resources has intensified over the years in Kenya due to rapid population growth.
Before the program of PHE, we had problems. We had diarrhea. We were losing children at an early stage. We were having population pressure, and people were scrambling for land.
Programs that build on the synergistic interventions such as PHE integrated approach model has proved to produce sustainable results. These results have contributed to the improvement of the quality of life of the population in the PHE projects. Program sites in Homa Bay, Siaya, Kuresoi North and South in Nakuru, Baringo and Kilifi counties in Kenya.
We have learned a number of lessons from the implementation of the PHE model homes. Among these lessons that we have learned is that one, model homes really make PHE implementation real as a community strategy. That's number one. Number two is that PHE model homes actually promote health-seeking behavior, they promote population management, and they also promote environmental conservation.
There is a need for governments, national and county, together with donors to support integrated interventions such as PHE to enable households and communities to reap long-term benefits and provide a basis for long-term sustainable programming driven by community needs.
PHE is a viable development program or a development agenda that can actually help us deliver on the Sustainable Development Goals as well as the ICPD 25 commitments that we have made.
Right now in the country, what we are focusing on as NCPD is to be able to roll out PHE countrywide, and the approach that we are using is to be able to establish population, health and environment technical working groups in all the counties.
There is a need to enhance support to integrated approaches and programs such as PHE initiatives instead of vertical or single sector funding, together with the encroachment of NGOs, communities and national and county governments to implement multi-sectoral partnerships and programs to meet both their health and environmental goals and aspirations in Kenya. NCPD has commenced the development of a national PHE policy guideline 2022-2030 to strengthen the implementation of the current and future strategic plans for PHE, as well as supporting other existing legal and policy frameworks on sustainable development.
What we've done so far is through the support of Lake Victoria Basin Commission Secretariat. Kenya was able to develop a strategic plan of PHE, population health and environment integrated approaches. And this integrated strategic plan runs from 2018 to 2022.
The PHE program is premised on the understanding that people's health and livelihood depends on the state of their environment, and therefore any attempts to address challenges in these sectors requires integrated solutions.
We have a proper sanitation, proper nutrition. We also have proper environment, clean environment, and that's our major aim. And we are now having a group which are now falling under population, health and environment. And we have been doing several things. And first of all, may I appreciate since we started working with the NCPD, they have really promoted us, because some areas were having very big challenges, especially in water. But when we requested for the tanks, now we have, these people are now having clean water. They can even use that water for irrigating their small plots, kitchen gardening projects.
A number of the PHE projects are now being implemented by various partners and communities in different parts of the country.
When we are talking about the efforts that NCPD has put in place that facilitated the model household clusters that we identified to get about 30 water tanks, which were about 3,000 liters each, with 2 of the 30 households getting 5,000 liter tank. This in essence was trying to help boost or help develop learning centers where communities can come in and learn what PHE is all about.
Among the projects being implemented by LVBC is a PHE program whose implementation is guided by the East Africa Community Integrated Population, Health and Environment Strategic Plan that covers the period 2016 to 2021. The Kenya National Policy Steering Committee, NPSC, for the PHE was established in 2016. Its key role is to provide policy direction for the PHE program in Kenya, and it meets annually. Below the NPSC, there is the National PHE Technical Working Group, TWG, and the National PHE Network.
By 2016, as we started PHE, our population was quite high. Most of our mothers were delivering at home. Most of our mothers had so many complications. We had maternal death, but through that integration, right now, everything has improved. For the last 3 years, we have not recorded any maternal death as per today.
The TWG comprises representatives of the various government institutes that have a stake in the implementation of the PHE program in the country. This group reports to the NPSC and has the responsibility of providing technical support required for implementation of the PHE program. The National PHE Network is a forum where both government and non-government institutions involved in the implementation of the PHE activities meet to share the program's progress and challenges. NCPD serves as the secretariat to the NPSC, TWG, and the Network Forum. The above management structure for PHE is being replicated in the counties.
We are moving around in Homa Bay County to learn more about PHE best practices. And I just want to mention that the idea of PHE was borrowed in Homa Bay County, was borrowed from the Kenya PHE Network, whereby we had a number of partners who are members of the Kenya PHE Network who are coming from Homa Bay County. So they learned something that they were happy about, and they were able to bring that idea back home in Homa Bay County.
PHE in Homa Bay County was a pilot project, and I am happy that I participated in rolling out the same to Siaya County. So the arrangement here for National Council and Population Services is key into this because of the work that they do. They are looking at the population size. And if you look at the P aspect, which is affecting health, first you manage the population. Once you manage a small population, the environment will be at peace. Once you have a small and manageable population, the health of the people will be at peace. So NCPD is a key partner. And what we are telling NCPD is to pick up. It was, first of all, it was funded by donors. The first Hope LVB project that we were running. Now NCPD needs to fit in, take over this, and ensure that this program is rolled out throughout the Republic of Kenya. And this is something that they can do because they have the networks and they have the structures to do that.
Population health and environment is an approach to sustainable development that integrates population and health in environmental conservation initiatives in order to ensure better outcomes for environment conservation efforts as well as improved health and well-being of the population.
And when it comes now to health, which is we are now involved in a variety of interventions that targets water, sanitation and hygiene, and the maternal child health. Now we are trying to educate the people around the lake to conserve the lake by not polluting the lake, by not throwing the plastic into the lake. You see, if the plastics are thrown into the lake, they kill the fish.
The PHE program is premised on the understanding that people's health and livelihood depends on the state of their environment, and therefore any attempts to address challenges in these sectors requires integrated solutions. Kenya embraced the PHE program in 2007 with the formation of the National PHE Network. This network has since been advocating and promoting the integration of population and health issues in the environment.
It was like estimated that 50% of our girls, before they get to age 18, they were either mothers or expectant with the first child in this particular sub-county. Those indicators with this program, they have actually improved, and the program also had a component of Bindi Shuja, which brings together the girls who got pregnant, and they are encouraged to go back to school. They are encouraged to talk to others. They are encouraged that life has not really come to an end. They need to move on. They need to go back to school and be economically empowered.
The East Africa Community, which comprises Kenya, Uganda, Tanzania, Rwanda, Burundi, and South Sudan, set up the Lake Victoria Basin Commission, LVBC, with the mandate of implementing programs and projects that would ensure the sustainable management of the natural resources in the Lake Victoria Basin.
Sasa wavuvi wamekuwa na multi-practices zingine ambazo haziruhusi kwa samaki. Unapata watu wanatumia things like monofilament ambazo inchi zao ni kidogo sana. So fish which are meant to grow to be bigger fish ndio wapatwe ama ndio washikwe. Unapata kama wanaolewa kama bado ni wadogo sana. So in future it means wakizaliwa wanauawa kabla hawajakuwa wakubwa. So that also brings the catch very ikuwe chini sana.
When you look at the health, it's looking at the well-being of the population. So you're looking at their mortality, you're looking at their morbidity, you're looking at issues of maternal health, child health, nutrition, water and sanitation, hygiene, and their total well-being.
Ilikuwa zamani tukiosha tu samaki kando kando ya bahari. Lakini baada ya kutoka kwa training, watu wote kina mama hata wanaume samaki wanachukua, aidha kama ni hapa wanachukua maji mengi kule chini kwenye mto, na wakitoka hapo wanaosha kwa maji ya mfereji, samaki wao wanakuwa katika hali ya usalama.
The activities undertaken in this project include policy guidance to member states, support to national PHE steering committees, and support to community PHE activities through community-based organization. Each year, the LVBC organizes meetings where reports on the activities undertaken by the Commission are reported. One such meeting is the Regional Policy Steering Committee meetings, which is attended by the Principal and Permanent Secretaries from the EAC member states. Another meeting is the Sectoral Council of Ministers meeting, which is attended by relevant ministers from the member states.
Mradi wa health of people and environment, ukija hapa kwanza kulikuwa na muhisani, kulikuwa na vikundi vya wahisani walikuja pamoja na wakafanya pilot kwa miaka 3, wakaona kazi imeenda vizuri, wakaongeza mwaka 1.5, alafu wakaja wakafanya kazi. Na kabla kufanya kazi kulikuwa na viongozi wengi, kwa sababu mradi ulikuwa ni kuhusisha watu wa sekta mbalimbali. Kulikuwa na madiwani kwa sababu ya kutengeneza sheria kule kwenye county assembly. Kulikuwa na chief kama mimi kwa sababu ya kuhusisha wananchi na kuhakikisha mambo ya mradi huu yanaenda sawasawa bila mtu kuharibu kitu ama kuingilia.
The National PHE Network is a forum where both government and non-government institutions involved in the implementation of the PHE activities meet to share the program's progress and challenges. In Kenya, the implementation of the PH program is mainly supported by the following partner organizations. 1. United States Agency for International Development, USAID. 2. Danish Family Planning Association, DFPA. 3. Pathfinder International. 4. Population Reference Bureau. 5. Family Health Options of Kenya, FHOK. These organizations are instrumental in advocating for PHE and supporting community initiatives on the same. Between 2011 and 2019, the Health of People and Environment in the Lake Victoria Basin, HOPE LVB project, was implemented by Pathfinder International. This was a PHE project aimed at supporting various communities in the Lake Victoria Basin region. Communities in Homa Bay County are among those that benefited from this project.
Like in Homa Bay County, the main focus of the PHE approach is household-based approach, where the PHE activities are around the household, what we are calling the PHE model homes. And you find in the PHE model homes, we try to ensure that the home can be able to get water, they are able to grow food within their farms there. They have a proper toilet. They have also proper other sanitary activities within the home. So that is the model around the PHE approach in Homa Bay.
In December 2020, NCPD procured 20 water tanks through support from UNFPA for the two mentioned PHE groups in Homa Bay County.
So we've worked closely with WWF Kenya also as a partner, and we've been able to target the BMUs and improve on their livelihood. Apart from the fishing, which is the key mandate of the beach management unit, we also encourage them to engage in other livelihood practices. If more people can come on board and use this approach in the implementation, we'll be able to reach many more people, and it will even be more impactful to Kilifi County and to Kenya as a whole.
Sahi usafi naona ni umeboreshwa zaidi kulingana na mambo. Hata sahi huwezi sikia mtoto anaharisha, huwezi sikia mtu mzima anaharisha, huwezi pata kigezo chochote cha kuharisha kwa sababu kulingana na ile kuosha mikono mara kwa mara. Kitambo ulikuwa unapata hospitali zimejaa na mambo na kolera. Sahi huwezi pata hospitali imejaa kuhusu mambo na usafi kwa sababu usafi ni mzuri zaidi kuliko ile useme kwamba mimi siwezi kufanya usafi katika nyumba zangu.
By understanding your population, you can plan for them. You can allocate resources for that specific population. If you have a very youthful population, if you have an elderly population, if you have a child-based population, it matters. So in that regard, we just need to understand what kind of population do we have, what challenges do that population have, and then how can we respond to the challenges of our population. And that's why this institution was formed, to look and understand and conduct research and advise the government on issues of population matter.
The visit by the Principal Secretary for Planning, who is also the chairman of the National PHE Policy Steering Committee, will be used to learn from the PHE communities in Homa Bay County and to officially hand over the water tanks to the beneficiaries as a way of motivating them to continue with implementation.
Tunafurahia eko serikali kwane agenda tunasonga mbele.
The National Council for Population and Development, NCPD, is a semi-autonomous national agency under the State Department of Planning and the National Treasury. This institution that's mandated to advise
Daktari Mohamed Abdikadir Sheikh. Mimi ni mkurugenzi mkuu wa National Council for Population and Development. Leo niko na furaha kuwakaribisha kutazama na kuiona kanda ya muziki iliyotungwa na kuimbwa na wafanyakazi wa NCPD. Karibuni sana.
Kwa
wanatuhitaji sana katika uzee wao.
mazingira yaliyo bora, hewa safi ya kupendeza ninaipata kwa Kenya wangu najivunia. Mandhari ya kupendeza, milima tuhifadhi kote. Mandhari ya kupendeza, tuhifadhi kote. Tuyatunze mazingira yetu, Kenya ibaki kuwa kivutio cha watalii. Mbuga zetu, misitu yetu yapendeza, urithi wetu, fahari yetu. Tuyatunze mazingira yetu, Kenya ibaki kuwa kivutio cha watalii. Mbuga zetu, misitu yetu yapendeza, urithi wetu, fahari yetu. Mandhari ya kupendeza, milima mito tuhifadhi kote. Mandhari ya kupendeza, milima mito tuhifadhi kote. Wazalendo wa wana Kenya, tukongole tunakutenda Kenya, uwala waridi daima tulitunze, mandhari yetu tulinde. Tukongole tunakutenda Kenya, uwala waridi daima tulitunze, kwa pamoja tusonge mbele. Tukongole tunakutenda Kenya, uwala waridi daima tulitunze, mandhari yetu tulinde. Tukongole tunakutenda Kenya, uwala waridi daima tulitunze. Serikali yetu hongera kwa ufadhili na nia njema. Kenya uwala linapendeza sana. Shirika letu la NCPD hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Serikali yetu hongera kwa ufadhili na nia njema. Kenya uwala linapendeza sana. Shirika letu la NCPD hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Serikali yetu hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Shirika letu la NCPD hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Mungu awabariki. kupendeza machoni kwetu, na wageni wakitutembelea. Tushikane mikono kwa Kenya, kwa pamoja tusonge mbele. Kenya yetu, urithi wetu hakika, tuilinde kwa hali na mali, uchochezi tusiukubali. Tumeshika amani, pamoja tushikamane, tuijenge Kenya. Tushikane mikono, kwa pamoja tujenge Kenya, tuilinde Kenya. Inatupasa tuwapende wanatuhitaji sana katika uzee wao. Inatupasa tuwapende wanatuhitaji sana katika uzee wao. Mpango thabiti unahitajika wazee wetu waishi kwa furaha na amani. Mpango thabiti unahitajika wazee wetu waishi kwa furaha na amani. Serikali twaipongeza shirika la NCPD kwa mipangilio bora. Serikali twaipongeza shirika la NCPD kwa mipangilio bora.
Dr. Mohamed Abdikadir Sheikh, the Director General of the National Council for Population and Development. Wazazi tuwaomba mwatunze watoto.
Wazazi twawaomba, tutunzeni watoto. Wazazi twawaomba, tutunzeni watoto. Tuwape mawaidha ya kuwasaidia, tuwape mawaidha ya kuwasaidia. Tusiache watoto wafunzwe na dunia, tusiache watoto wafunzwe na dunia. Tutafute nafasi, tukae na watoto. Tutafute nafasi, tukae na watoto.
Good morning everybody. Morning. Let me take this opportunity to welcome all of you. And before we start, tea is served. So please, we'll have 15 minutes for everybody to have a cup of tea. So you just walk straight from the registration area and go serve tea from there. And we come back in 15 minutes. Thank you.
NCPD, oh yeah, mumefanya mengi, oh yeah, tumeelimishwa, oh yeah, tunawapongeza, oh NCPD, oh yeah, kwa mipango bora, oh yeah, mambo ya idadi, oh yeah, serikali, oh yeah, kwa maendeleo, oh yeah, tunafurahia, oh yeah, kweli tumeona, eko serikali, oh yeah, kwa agenda, oh yeah, tunasonga mbele, vijana wetu, tuwape elimu, tuwape upendo, pia na mawaidha. Tunawatahadharisha dhidi ya pombe, madawa kulevya, tadhuru afya yao. Tunawatahadharisha dhidi ya pombe, madawa kulevya, tadhuru afya yao. Rieni kulinda maye, tusichoke kulinda vijana wetu, rieni kulinda maye, mwendo na tusichoke kulinda vijana wetu, lazima tufaulu. Kuwakomboa vijana wetu walioharibika. Tutunze vijana wetu, tuwape elimu, tuwape upendo, pia ndama wa tutunze vijana wetu, tuwape elimu, tuwape upendo, pia ndama wa tunawatahadharisha dhidi ya pombe, madawa kulevya, yadhuru afya yao. Tunawatahadharisha dhidi ya pombe, madawa kulevya, yadhuru afya yao. Tieni kulinda maye, mwendo na tusichoke kulinda vijana wetu. Tieni kulinda maye, Tulinde kwa pamoja tusonge mbele. Jukumu letu kulinda Kenya, kuwa na waridi daima tulitunze. Bandari yetu tulinde. Jukumu letu kulinda Kenya, kuwa na waridi daima tulitunze. Hongera kwa ufadhili na nia njema. Kenya huwa lango linapendeza sana. Shirika letu la NCPD, hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Hongera kwa ufadhili na nia njema. Kenya huwa lango linapendeza sana. Shirika letu la NCPD, hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Serikali yetu hongera, hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Shirika letu la NCPD, tunawashukuru, Mungu awabariki. Mungu awabariki.
Dr. Mohamed Abdikadir Sheikh, the Director General of the National Council for Population and Development. Wazazi tuwaomba mwatunze watoto.
Wazazi twawaomba, watunzeni watoto. Wazazi twawaomba, watunzeni watoto. Tuwape mawaidha ya kuwasaidia. Tuwape mawaidha ya kuwasaidia. Tusiache watoto wafunzwe na dunia. Tusiache watoto wafunzwe na dunia. Tutafute nafasi, tukae na watoto. Tutafute nafasi, tukae na watoto. Tuwafunze nidhamu pamoja na upendo. Tuwafunze nidhamu pamoja na upendo. Majukumu ni yetu, wazazi tukumbuke. Majukumu ni yetu. Wacha watoto wetu waende wakasome. Wacha watoto wetu waende wakasome.
Viongozi serikalini,
tueneze ujumbe kote.
Watifu hata nyumba kumi,
tusambaze habari kote.
Viongozi serikalini,
tueneze ujumbe kote.
Watifu hata nyumba kumi,
tusambaze habari kote. Lenye kulinda maye, tuwa protect watoto. rasilimali ili tuishi kwa amani, tupange familia, tuweke rasilimali ili tuishi kwa amani.
Eko NCPD, oh yeah, mumefanya mengi, oh yeah, tumeelimishwa, oh yeah, tunawapongeza. Oh, Eko NCPD, oh yeah, kwa mipango bora, oh yeah, mambo ya idadi, oh yeah, tunawapongeza. Eko serikali, oh yeah, kwa maendeleo, oh yeah, tunafurahia, oh yeah, kweli tumeona. Eko serikali, oh yeah, kwa ne agenda, oh yeah, tunasonga mbele, oh yeah, hata mashinani. Tutunze vijana wetu, tuwape elimu, tuwape upendo, pia na mawaidha. Tutunze vijana wetu, tuwape elimu, tuwape upendo, pia na mawaidha. Tunawatahadharisha dhidi ya pombe, madawa ya kulevya, yadhuru afya yao. Tunawatahadharisha dhidi ya pombe, madawa ya kulevya, yadhuru afya yao. Rieni kulinda maye, tukaze mwendo na tusichoke kulinda vijana wetu. Rieni kulinda maye, tukaze mwendo na tusichoke kulinda vijana wetu. Lazima tufaulu kuwakomboa vijana wetu walioharibika. Kweli lazima tufaulu kuwakomboa vijana wetu walioharibika. Tutunze vijana wetu, tuwape elimu, tuwape upendo, pia na mawaidha. Tutunze vijana wetu, tuwape elimu, tuwape upendo, pia na mawaidha. Tunawatahadharisha dhidi ya pombe, madawa ya kulevya, yadhuru afya yao. Tunawatahadharisha dhidi ya pombe, madawa ya kulevya, yadhuru afya yao. Rieni kulinda maye, tukaze mwendo na tusichoke kulinda vijana wetu. Rieni kulinda maye, tukaze mwendo na tusichoke kulinda vijana wetu. Lazima tufaulu kuwakomboa vijana wetu walioharibika. Lazima tufaulu kuwakomboa vijana wetu walioharibika. Tupongeze serikali yetu kwa jitihada za kujali
The National Council for Population and Development, NCPD, is a semi-autonomous national agency under the State Department of Planning and the National Treasury. This institution that's mandated to advise and coordinate issues of population and development in the country. And the role of this institution is to research, analyze population programs, and again advise the government on those findings. We are supposed to advocate and inform the public on issues of population programming, and at the same time also do coordination and implementation of population program across the country.
The concept of PHE integration approach model is not a new one, as it originated from the 1992 Rio Summit Declaration on Environment and Development, UNICED. The Earth Summit. The conference identified the synergy between population, health, and environment as crucial building blocks for achieving sustainable development.
PHE as an integrated approach started as a result of an assessment that was carried out in Kenya, Uganda, Tanzania and Rwanda. And this was an initiative of the Population Reference Bureau of USA. And after this assessment was done, we had the first ever international conference on population health and environment integrated approaches in Addis Ababa, Ethiopia. That was November 2007.
PHE is integration of health, environment, and the people livelihood and the existence. So this is a sustainable, is a developmental matter, and the National Council for Population and Development has taken this matter and is coordinating these activities in certain areas in the country, especially in the lake regions, in the coastal regions, and in some part in Rift Valley.
Population Health and Environment Program is one of the sustainable approaches to development that Kenya has adopted. Kenya adopted this approach way back in 2007, and since then we've been able to roll out PHE projects in the country, and the areas where we've really succeeded in PHE are in Homa Bay, in Kilifi County, and also in Nakuru County.
In Kenya, recognition and adoption of the PHE integrated approaches model came into the limelight during the International Conference on Population, Health and Environment held in Addis Ababa, Ethiopia in November 2007. Prior to this conference, Kenya had conducted the PHE assessment, whose report showed that although some PHE integrated projects had the three aspects of PHE, others were either implementing two aspects or just one.
Basically, Kuresoi benefited from one of the programs that was run by Aviausase called PHE, and in our sub-county it was covering 3 wards, that is Keringet where we are, Amalo and then Tineta. So in all these programs actually it was done across the 3 wards, and actually concerning the same, our sub-county benefited a lot. In our sub-county we have got 29 community health units, and in these community health units we have got 241 community health volunteers. These community health volunteers, they were trained by Afiausase in all the health indicators within the community.
And why Kuresoi North and South were chosen is because over the years those sub-counties were lagging behind in health indicators in the county. So most of the time, they used to be reprimanded that they were at the bottom, all the time when they report to the county health management team. And it was, FHI came in to help them try to improve the population health indicators.
Mimi kabla PAG kuja tulikuwa tunaishi maisha mbaya. Hatuko tunajua utaweza enda toilet, unawe mkono ukitoka. Wakakuja wakatufunza ukienda toilet, hata kama nyumbani ni safi ndani ya nyumba na umetoka toilet ni chafu sana. So inabidi uoshe mkono, usichukue uchafu kwa nyumba. Tukafunza, hatuko tunajuaga. In fact, toilet yenye nilikuwa natumia ilikuwa ambao, so ilikuwa chafu. Ndio penye walitufunza nikakuja nikajenga hii. Nilikuwa natumia ingine iko mahali hapo hivi.
This project came to Kuresoi South in Nakuru County because within Nakuru County, this is the sub-county, Kuresoi South, that had poor indicators in terms of maternal health, child health, maternal mortality. We had more incidents of women dying and they could not access services at the healthcare system. And if you look at also the health facility, it was not also very well equipped with the facilities to take care of these women around this particular place.
PHE integrated approach model is one of the sustainable development model which has been proved to be a key driver in the improvement of quality of life of people at both household and community level. People deal simultaneously with food, water, livelihoods, health and education, among other issues, including fertility. There has been an increasing pressing global and national population, health and environmental sustainability challenges such as rapid population growth, unmet need for family planning, malnutrition, environmental degradation and the effects of climate change.
When you come to Nakuru and Kilifi, the approach is a bit different. You find that the approach here is more towards the external environment, not in the homestead, but the external environment. Like in Nakuru, you find the Molo area, the approach is mainly towards conservation of the forest there. So as the communities conserve the forest there, which helps them in terms of firewood and also other livelihoods, now they also have other activities which they now come and do within their community and in the household to promote their health.
Communities are being sensitized, trained, equipped and empowered to ensure that they can have a livelihood from the water, but at the same time also protecting and conserving the environment that they coexist with.
Kwa sababu hii elimu tulioipata imetupa manufaa mengi sana. Hata wasichana ambao pengine walikuwa wanahitaji zile mimba za mapema, anaelezea msichana mwenzake, elimu ni bora zaidi kuliko kupata mimba ya mapema. Kwa sababu tukisema hii elimu ndio ufunguo wa maisha, lakini tukisema tunajiweka katika ngono za mapema alafu na mambo na mihadarati, hiyo haituletei faida kwetu.
Wakati wa pusi huwa baharini hakuna samaki. Sasa imetubidi sisi wanaofundishwa PHE tujikimu kimaisha, hali ya kuwa huko juu kama chini hakuna samaki, huko juu tunapata mapeni ya kupeleka watoto shule, wanapata lishe bora ambao hasa kutusaidia hatutakuwa na ile hali ngumu ya kimaisha.
It is important to note that changes in population and the environment is critical in determining the health of the people in a given area.
The National Council for Population and Development is working very closely with this community on issues of population health and environment. Here, from the environment here, you can see the mangroves are well kept, that you can see the people have sustained or have taken care of the environment, that they don't pollute the environment, and they are trained on issues of how they can have child spacing or family planning so that at least the families have a quality life and quality health.
In areas where pregnancies among women occur too early, too late, or too frequently, more often women also experience frequent illness during pregnancy and complications at the time of birth.
Under PHE we have now, we are having the youth section. So wherever they have their representative who usually come and report. Whenever we have all of them, they also talk, and mainly we find the importance of family planning, and even sometimes we can even incorporate family planning with the kind of plans that we have.
Population health and environment PHE is a development approach which recognizes the interconnectedness between the people's livelihoods, their health and the environment in which they depend. And now when I take, if I now unpack the P, which is the population, we are now targeting family planning. And in family planning, we deliver information and services to the community so that they can have healthy timing and child spacing, so that the fish in the lake which is reserved can be utilized by the children, our children, for now and even for in future.
Through BMU and the government, we can see a way of educating our people on the correct pacing, so that they see how they plan well on when to have the firstborn, like that. And that if we can manage on that, it means we can suppress the population and we can go on well.
areas experiencing high fertility, high population densities, poor sanitation, high levels of poverty, have highest numbers of people who are unable to meet their dietary needs and food preferences for an active and healthy life. Quite often, these conditions increase incidences of diseases among households and communities in general.
We're just visiting the garden and we're just trying to see how the PHE program is doing here in your household. And it's very impressive to see, that it's a concept that is well integrated, that you have a small-scale farming system around, you have a GECO that is energy saving, and you have a dish rack to make sure that you see your dish after they're washed, they are clean and they're safe for use, and then also the eco-friendly toilet.
The model household means that I must have 8 components, such as toilet, kitchen garden, licketing, wireline, dish rack, bathroom, and I must have fresh water for drinking.
Demand for water, forests and land mounts and pressure on finite resources has intensified over the years in Kenya due to rapid population growth.
Before the program of PHE, we had problems. We had diarrhea. We were losing children at early stage. We were having population pressure, and people were scrambling for land.
Programs that build on the synergistic interventions such as PHE integrated approach model has proved to produce sustainable results. These results have contributed to the improvement of the quality of life of the population in the PHE projects. Program sites in Homa Bay, Siaya, Kuresoi North and South in Nakuru, Baringo and Kilifi counties in Kenya.
We have learned a number of lessons from the implementation of the PHE model homes. Among these lessons that we have learned is that one, model homes really make PHE implementation real as a community strategy. That's number one. Number two is that PHE model homes actually promote health-seeking behavior, they promote population management, and they also promote environmental conservation.
There is a need for governments, national and county, together with donors to support integrated interventions such as PHE to enable households and communities to reap long-term benefits and provide a basis for long-term sustainable programming driven by community needs.
PHE is a viable development program or a development agenda that can actually help us deliver on the Sustainable Development Goals as well as the ICPD 25 commitments that we have made.
Right now in the country, what we are focusing on as NCPD is to be able to roll out PHE countrywide, and the approach that we are using is to be able to establish population, health and environment technical working groups in all the counties.
There is a need to enhance support to integrated approaches and programs such as PHE initiatives instead of vertical or single sector funding, together with the encroachment of NGOs, communities and national and county governments to implement multi-sectoral partnerships and programs to meet both their health and environmental goals and aspirations in Kenya. NCPD has commenced the development of a national PHE policy guideline 2022-2030 to strengthen the implementation of the current and future strategic plans for PHE, as well as supporting other existing legal and policy frameworks on sustainable development.
What we've done so far is through the support of a Lake Victoria Basin Commission Secretariat. Kenya was able to develop a strategic plan of PHE, population health and environment integrated approaches. And this integrated strategic plan runs from 2018 to 2022.
The PHE program is premised on the understanding that people's health and livelihood depends on the state of their environment, and therefore any attempts to address challenges in these sectors requires integrated solutions.
We have a proper sanitation, proper nutrition. We also have proper environment, clean environment, and that's our major aim. And we are now having a group which are now falling under population health and environment. And we have been doing several things. And first of all, may I appreciate since we started working with the NCPD, they have really promoted us, because some areas were having very big challenges, especially in water. But when we requested for the tanks, now we have, these people are now having clean water. They can even use that water for irrigating their small plots, kitchen gardening projects.
A number of the PHE projects are now being implemented by various partners and communities in different parts of the country.
When we are talking about the efforts that NCPD has put in place that facilitated the model household clusters that we identified to get about 30 water tanks, which were about 3,000 liters each, with 2 of the 30 households getting 5,000 liter tank. This in essence was trying to help boost or help develop learning centers where communities can come in and learn what PHE is all about.
Among the projects being implemented by LVBC is a PHE program whose implementation is guided by the East Africa Community Integrated Population Health and Environment Strategic Plan that covers the period 2016 to 2021. The Kenya National Policy Steering Committee, NPSC, for the PHE was established in 2016. Its key role is to provide policy direction for the PHE program in Kenya, and it meets annually. Below the NPSC, there is the National PHE Technical Working Group, TWG, and the National PHE Network.
By 2016, as we started PHE, our population was quite high. Most of our mothers were delivering at home. Most of our mothers had so many complications. We had maternal death, but through that integration, right now, everything has improved. For the last 3 years, we have not recorded any maternal death as per today.
The TWG comprises representatives of the various government institutes that have in the implementation of the PHE program in the country. This group reports to the NPSC and has the responsibility of providing technical support required for implementation of the PHE program. The National PHE Network is a forum where both government and non-government institutions involved in the implementation of the PHE activities meet to share the program's progress and challenges. NCPD serves as the secretariat to the NPSC, TWG, and the Network Forum. The above management structure for PHE is being replicated in the counties.
We are moving around in Homa Bay County to learn more about PHE best practices. And I just want to mention that the idea of PHE was borrowed in Homa Bay County, was borrowed from the Kenya PHE network, whereby we had a number of partners who are members of the Kenya PHE network who are coming from Homa Bay County. So they learned something that they were happy about, and they were able to bring that idea back home in Homa Bay County.
PHE in Homa Bay County was a pilot project, and I am happy that I participated in rolling out the same to Siaya County. So the arrangement here for National Council and Population Services is key into this because of the work that they do. They are looking at the population size. And if you look at the P aspect, which is affecting health, first you manage the population. Once you manage a small population, the environment will be at peace. Once you have a small and manageable population, the health of the people will be at peace. So NCPD is a key partner. And what we are telling NCPD is to pick up. It was, first of all, it was funded by donors. The first Hope LVB project that we were running. Now NCPD needs to fit in, take over this, and ensure that this program is rolled out throughout the Republic of Kenya. And this is something that they can do because they have the networks and they have the structures to do that.
Population health and environment is an approach to sustainable development that integrates population and health in environmental conservation initiatives in order to ensure better outcomes for environment conservation efforts as well as improved health and well-being of the population.
And when it comes now to health, which is we are now involved in a variety of interventions that targets water, sanitation and hygiene, and the maternal child health. Now we are trying to educate the people around the lake to conserve the lake by not polluting the lake, by not throwing the plastic into the lake. You see, if the plastics are thrown into the lake, they kill the fish.
The PHE program is premised on the understanding that people's health and livelihood depends on the state of their environment, and therefore any attempts to address challenges in these sectors requires integrated solutions. Kenya embraced the PHE program in 2007 with the formation of the National PHE Network. This network has since been advocating and promoting the integration of population and health issues in the environment.
It was like estimated that 50% of our girls, before they get to age 18, they were either mothers or expectant with the first child in this particular sub-county. Those indicators with this program, they have actually improved, and the program also had a component of Bindi Shuja, which brings together the girls who got pregnant, and they are encouraged to go back to school. They are encouraged to talk to others. They are encouraged that life has not really come to an end. They need to move on. They need to go back to school and be economically empowered.
The East Africa Community, which comprises Kenya, Uganda, Tanzania, Rwanda, Burundi, and South Sudan, set up the Lake Victoria Basin Commission, LVBC, with the mandate of implementing programs and projects that would ensure the sustainable management of the natural resources in the Lake Victoria Basin.
Sasa wavuvi wamekuwa na multi-practices zingine ambazo haziruhusi kwa samaki. Unapata watu wanatumia things like monofilament ambazo inchi zao ni kidogo sana. So fish which are meant to grow to be bigger fish ndio wapatwe ama ndio washikwe. Unapata kama wanaolewa kama bado ni wadogo sana. So in future it means wakizaliwa wanauawa kabla hawajakuwa wakubwa. So that also brings the catch very ikuwe chini sana.
When you look at the health, it's looking at the well-being of the population. So you're looking at their mortality, you're looking at their morbidity, you're looking at issues of maternal health, child health, nutrition, water and sanitation, hygiene, and their total well-being.
Ilikuwa zamani tukiosha tu samaki kando kando ya bahari. Lakini baada ya kutoka kwa training, watu wote kina mama hata wanaume samaki wanachukua, aidha kama ni hapo wanachukua maji mengi kule chini kwenye mto, na wakitoka hapo wanaosha kwa maji ya mfereji, samaki wao wanakuwa katika hali ya usalama.
The activities undertaken in this project include policy guidance to member states, support to national PHE steering committees, and support to community PHE activities through community-based organization. Each year, the LVBC organizes meetings where reports on the activities undertaken by the Commission are reported. One such meeting is the Regional Policy Steering Committee meetings, which is attended by the Principal and Permanent Secretaries from the EAC member states. Another meeting is the Sectoral Council of Ministers meeting, which is attended by relevant ministers from the member states.
Mradi wa health of people and environment, ukija hapa kwanza kulikuwa na muhisani, kulikuwa na vikundi vya wahisani walikuja pamoja na wakafanya pilot kwa miaka mitatu. Wakaona kazi imeenda vizuri, wakaongeza mwaka 1.5, alafu wakaja wakafanya kazi. Na kabla kufanya kazi kulikuwa na viongozi wengi, kwa sababu mradi ulikuwa ni kuhusisha watu wa sekta mbalimbali. Kulikuwa na madiwani kwa sababu ya kutengeneza sheria kule kwenye county assembly. Kulikuwa na chief kama mimi kwa sababu ya kuhusisha wananchi na kuhakikisha mambo ya mradi huu
yanaenda sawasawa bila mtu kuharibu kitu ama kuingilia.
The National PHE Network is a forum where both government and non-government institutions involved in the implementation of the PHE activities meet to share the program's progress and challenges. In Kenya, the implementation of the PH program is mainly supported by the following partner organizations. 1. United States Agency for International Development, USAID. 2. Danish Family Planning Association, DFPA. 3. Pathfinder International. 4. Population Reference Bureau. 5. Family Health Options of Kenya, FHOK. These organizations are instrumental in advocating for PHE and supporting community initiatives on the same. Between 2011 and 2019, the Health of People and Environment in the Lake Victoria Basin, HOPE LVB project, was implemented by Pathfinder International. This was a PHE project aimed at supporting various communities in the Lake Victoria Basin region. Communities in Homa Bay County are among those that benefited from this project.
Like in Homa Bay County, the main focus of the PHE approach is household-based approach, where the PHE activities are around the household, what we are calling the PHE model homes. And you find in the PHE model homes, we try to ensure that the home can be able to get water. They are able to grow food within their farms there. They have a proper toilet. They have also proper other sanitary activities within the home. So that is the model around the PHE approach in Homa Bay.
In December 2020, NCPD procured 20 water tanks through support from UNFPA for the two mentioned PHE groups in Homa Bay County.
So we've worked closely with WWF Kenya also as a partner, and we've been able to target the BMUs and improve on their livelihood. Apart from the fishing, which is the key mandate of the beach management unit, we also encourage them to engage in other livelihood practices. If more people can come on board and use this approach in the implementation, we'll be able to reach many more people, and it will even be more impactful to Kilifi County and to Kenya as a whole.
Sahi usafi naona ni umeboreshwa zaidi kulingana na mambo. Hata sahi huwezi sikia mtoto anaharisha, huwezi sikia mtu mzima anaharisha, huwezi pata kigezo chochote cha kuharisha kwa sababu kulingana na ile kuosha mikono mara kwa mara. Kitambo ulikuwa unapata hospitali zimejaa na mambo na kolera. Sahi huwezi pata hospitali imejaa kuhusu mambo na usafi kwa sababu usafi ni mzuri zaidi kuliko ile useme kwamba mimi siwezi kufanya usafi katika nyumba zangu.
By understanding your population, you can plan for them. You can allocate resources for that specific population. If you have a very youthful population, if you have an elderly population, if you have a child-based population, it matters. So in that regard, we just need to understand what kind of population do we have, what challenges do that population have, and then how can we respond to the challenges of our population. And that's why this institution was formed, to look and understand and conduct research and advise the government on issues of population matter.
The visit by the Principal Secretary for Planning, who is also the chairman of the National PHE Policy Steering Committee, will be used to learn from the PHE communities in Homa Bay County and to officially hand over the water tanks to the beneficiaries as a way of motivating them to continue with implementation.
Tunafurahia serikali kwane agenda tunasonga mbele hata mashinani. Tupongeze serikali yetu kwa jitihada za kujali maslahi. hewa safi ya kupendeza ninaipata kwa Kenya wangu najivunia. Mungu wangu nakushukuru, nimezaliwa kwa mazingira yaliyo bora, hewa safi ya kupendeza ninaipata kwa Kenya wangu najivunia. Mandhari ya safi kuwa kivutio cha watalii. Mbuga zetu, misitu yetu yapendeza, urithi wetu, fahari yetu. Tuyatunze mazingira yetu, Kenya ibaki kuwa kivutio cha watalii. Mbuga zetu, misitu yetu yapendeza, urithi wetu, fahari yetu. Mandhari ya safi pendeza, milima mito safi tuhifadhi kote. Mandhari ya safi pendeza, milima mito tuhifadhi kote. Wazalendo wana Kenya, tukongole tunakwenda Kenya, ua la waridi daima tulitunze, kwa angari yetu tulinde. Tukongole tunakwenda Kenya, ua la waridi daima tulitunze, kwa pamoja tusonge mbele. Tukongole tunakwenda Kenya, ua la waridi daima tulitunze, bandari yetu tulinde. Tukongole tunakwenda Kenya, ua la waridi daima tulitunze. Serikali yetu hongera kwa ufadhili na nia njema. Kenya ua lako linapendeza sana. Shirika letu la NCPD hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Serikali yetu hongera kwa ufadhili na nia njema. Kenya ua lako linapendeza sana. Shirika letu la NCPD hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Serikali yetu hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Shirika letu la NCPD hongera sana kwa kazi nzuri. Tunawashukuru, Mungu awabariki. Mungu awabariki. should bring it down. We should save our young people from early marriage. We should save our young people from early marriage, pregnancy and drugs. Kenya, let's fight the challenges that face young people. STD, FGM, unsafe abortions, HIV and AIDS. STD, FGM, unsafe abortions, HIV and AIDS. Kenya, let's fight the challenges that face young people. Drugs and teenage pregnancies, lack of access to reproductive care. Drugs and teenage pregnancies, lack of access to reproductive care.
Good morning, everybody. Have you all taken tea? Okay, thank you. We are about to start the formal part of our celebrations. All our chief guests are here. So I would request all of us to stand and welcome our chief guests. Then we shall take the program from there. Please, let's be upstanding. So as they come, I would just like to give you a quick rundown of what is going to be happening. We'll have a short speech by the Director General of NSPD, and from there we'll go into a panel discussion with our youths as per our theme of this event today. And then we'll have some remarks from our partners and a keynote address from our chief guest, who is the Economic Secretary in the State Department of Economic Planning. And then we'll go for lunch and we call it a day. So I urge your patience as we have this event going. Okay, just relax. I'm told, sorry, just relax. But it is good exercise, you don't sleep. Okay, good morning once again. Our chief guests are here, so let's just welcome them with a lot of applause. Okay, while we remain standing, we will have a word of prayer followed by the national anthem. Mr. Lubanga, please. Word of prayer.
Our chief guests and everyone else, good morning. Let's pray. Loving Father, we are grateful that you've allowed us again to see the light of the day. We thank you, our God, for you are the creator of the heaven and the earth and everything therein. We thank you, Lord, for even you created us and you created boundaries. You placed us in such a part of the universe that, Lord, we may fulfill your purposes. And we thank you for such a day that we've gathered for this event, even the World Population Day, looking into the issues of population and looking, Lord, even to the young people. Thank you, Lord, for indeed your word even goes to the young, that they are young and strong for fulfillment of your purposes. So we pray, even as we deliberate the issues together, that your spirit may lead us. We pray that even in our minds, in our spirit, we may perceive that which is your purpose. And we pray for grace, even within us, that you may come through for us. Even we commit this lovely nation. And Lord, even we contribute to the global goals. We pray that even our boundaries may be blessed, our leaders may be blessed. We pray for sanity. We pray for every good intention, that Kenya may, Lord, be looked as even a rock bed of revival for your glory. For these and many other things which are, Lord, they are resident in our spirits, we pray that your Holy Spirit may pray for us. This we pray in Jesus' name. Amen. Thank you.
Thank you. Let's remain standing for the national anthem and the East African anthem, please.
Mungu nguvu yetu, Utaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
So to set us off this morning, we will start with a word from the Director General of the National Council for Population and Development. But before he comes, I would like just to recognize our guests who are led by Mr. Timothy Gakuo, the Economic Planning Secretary, our board member, Mr. James Kimonye, who is representing the chairman, Dr. Julius Karangi, our board member, Madam Leah Chichil, the Director General, Dr. Mohamed Sheikh, Mr. Paul Makwinja, the International Operations Manager and Officer in charge of UNFPA, Kenya, Dr. Shaheen Nilofa, the Country Representative, UNICEF Kenya, senior government representatives, our development partners, civil society organizations, the media, the NSPD staff, distinguished guests, and everybody else feel appreciated. And now it is my pleasure to invite Dr. Mohamed Sheikh to say a few words before we begin the rest of the program. Thank you.
So thank you, Robert. Our chief guest, our economic planning secretary, Mr. Timothy Kaguo, the representative of our chair, Director James Kimonye, UNICEF Country Director, Mrs. Shaheen Nilofa, International Operational Manager of UNFPA, Mr. Paul Makwinja, our development partners present, senior government present, civil society organization, distinguished guests, ladies and gentlemen, good morning. Good morning. Really, it's a great morning. Today we are celebrating the World Population Day. It's a belated World Population Day. We were supposed to have this function or this event on a population age structure. Population age structure. So, ladies and gentlemen, I'm delighted to welcome you all for this year World Population Day celebration. To welcome you all for this year World Population Day celebration. This year we postponed our national celebration due to factors beyond our control, and thus the change of date from the initial date of 11th of July to today 31st. People first are resource number one as in for our nation. And we must understand resource number one as in for our nation. And we must understand that for our nation. And we must understand that resource number one in terms of their size on issues to do with the theme of the day, which is embracing data for decision making using evidence to invest in adolescent and young people. At this juncture, I want to invite Lucy Kimondo to do a presentation on behalf of the council, just to give a highlight on what this issue is all about. Lucy?
Okay, thank you, Dr. Mohammed. We will have Bernard Kiprotich for the adolescent presentation. So as he prepares to come, I was checking something today, and they're saying that
there are those who have disability in one way or another. It is just general disability. And in terms of distribution by sex, you realize that more male, or in this case the boys, they are more disabled than the girls in terms of absolute numbers. They are about 35,000. That's as per 2019 analytical reports of the census. So again, we have variations across counties in terms of disability, whereby the counties which have registered high prevalence of disability, and among these counties is Homa Bay, the Siaya, Embu, Meru, Vihiga, and Kakamega. Those are just a few of the counties which have recorded highest proportion of disability among the adolescents. So let's look in terms of poverty. In this case, we are looking at multidimensional poverty. And when we talk of multidimensional poverty here, we are talking of those adolescents who are deprived in terms of access to education, access to health, also living standards in terms of their housing, where they live. Again, in terms of protection. This protection also comes in terms of the legal protection. How are they protected legally? And also economic stability. So you realize about half, and this one we are talking of young children aged 0 to 17 years, they are deprived in one way or another across those key dimensions of poverty. And in this case, we are seeing more boys are more deprived than girls, although the percentages are not that high, but the boys, about half of the boys are deprived of these issues of education, health, living standards, protection, and economic stability. So that's the situation as it is. I think maybe we can do further research why the boys are more deprived than the girls, but that is the status as it is. Next. Well, let's look about their health and well-being in terms of sexual debut. So sexual debut here, we are focusing on those young people aged 15 to 24. So this is based on the Kenya Demographic and Health Survey, which was conducted in 2022. So, and 19% of boys reported that they had sexual intercourse before the age of 15. So, and it was lower among the girls. That 19 was contributed from 10 counties. That's Kisumu, Homa Bay, Siaya, Migori, Nakuru, Nairobi, Uasin Gishu, Kisii, Kajiado, and Kakamega. So those are the counties which are contributing to that 40%, which we are saying 4 out of 10 girls and 3 out of 10 boys, 15 to 19 are ever tested. That's in terms of testing. That's in terms of testing. In terms of sexual and gender-based violence, you remember the issue of deprivation. Again, we realize that our adolescents 10 to 19, but for this case, we are focusing those who are 15 to 19, who have ever experienced physical violence and sexual violence. So, and among our women, about 28% have experienced physical violence and 3% have experienced sexual violence. So maybe we need to know the perpetrators here. We've not brought out about the perpetrators. So, and we are saying that more adolescent boys are experiencing physical violence compared to girls, while more adolescent girls are experiencing sexual violence. So I think this is something which we need to do. So you can see now the evidence, so that we use this evidence for programming and ensure that our girls are not sexually abused. Next. Well, again, this issue of drug and substance abuse has been an issue among our young people and also adolescents. So, and that's how the trends has been in terms of the male and female, and also in terms of the rural and urban. So, again, of interest, you realize also those from the males are the ones who are using drugs more than the females. And in terms of mental health, of course, still these young adolescents have also issues of mental health, where you realize that more adolescent girls were undergoing treatment on issues of depression and anxiety. So you realize 14% of boys and 30% of girls. So this is based on the 2022 Kenya Demographic and Health Survey. So you realize even that these young adolescents are also undergoing generations, but also you realize there is an emerging issue of mental health, which again, in terms of nutritional status, this is the trend in terms of the girls and the boys. That's the women. So about so when we say underweight, the BMI is less than 18. Is it 18? 18.5. So those are thin. They are underweight. Again, there are those who are obese. That's more than 30. The BMI is more than 30. That is 2% for women and 1%. That is 2% for women and 1%. Again, we have those who are overweight, but again, we are interested for those who are at the normal weight, which was based on their 5% did not consume the recommended minimum number of food groups. So I think maybe the nutritionists can expound on that. 9% also were aware of diseases treated to low intake of fruits and issues of obese and overweight. Next. We need also to see in terms of access, because we are all aware this group of 10 to 19, they are supposed to be in school. But unfortunately, there are still those who do not have education. Those 6 to 13 years, and also among 14 to 17 years. So that is the percentage of those adolescents 6 to 17 years who did not have education. Also again, there is issue of child labor, so whereby these young adolescents are engaged in economic activities, and nationally in 2019, so 35% children aged 5 to 17 years were engaged in an economic activity. So again, in terms of urban and rural, coverage on this group who are not anywhere in the education, not in employment, and not in any training. Next. Well, I know ICT has been something which our young people has been embracing. So mobile phone, and those are the figures in terms of their age groups. Also wanted to see how these adolescents also are participating, and we looked in terms of active participation in terms of their voting. So, and the numbers who are eligible for voting, those who are 18 years. I know in Kenya, if you are 18 years, of course, you'll have acquired an ID, and you are also supposed to register. So we had 2 million of them who were registered, but those 18 or 19 years registered voters in 2022. So those were the registered voters in 2022. So those were the registered voters in 2022 according to the IEPC, but of interest are participating in terms of issues of exercising their rights. Next. Well, that's all that we would like to improve, so that we embrace these issues of data for us to get evidence. So as much as we have some information about our adolescents, we still have inadequate data on those 8, 10 to 14 years. So you realize even in KDHS, we are capturing information of those 8 to 15 to 19. But here we are talking of adolescents are 8, 10 to 19. So we need to get also information about those 10 to 19 years. So issue of also disaggregation of adolescent data. So in this case, you realize most of our reports, we are lumping these age groups. In most cases, we are lumping 15 to 24 years. So we are lacking that information of those particularly 10 to 14 years, because we really need to have, and we are talking here today that we need to embrace in issues of data so that we make informed decisions. Also, issues of primary data and administrative data is not fully analyzed. You realize that if we analyze fully our primary data, we are able to get more information about our young people, particularly those adolescents 10 to 19. So, and we are recommending a platform to coordinate data producers and data users. So in this case, we are able to collect all the info to plan for this population. So thank you so much. That's the end of my presentation. I hope you now know the situation of our adolescents in our country, Kenya. So, and I'd like just to thank these people who helped us work in this presentation. That is KNBS. You realize most of the data we were quoting from Kenya National Bureau of Statistics. Also UNICEF, worked closely, and also UNFPA in coming up with this information. Thank you very much.
Thank you, Bernard. Now we are going to a very brief panel discussion. So as we set up, we'll show you some few things that NCPD has been doing. But as that's been set up, I would like to, the moderator is it an adolescent or a youth? Godana Yusuf, who will moderate this session. The youth representative we have is Moses Mwema, Paul Waweru from KNBS. From the CSOs, we have Nicole Molly, and we have Lucy Kimodo from NCPD. So welcome them as they prepare to come. Thank you.
Thank you very much, Robert. I can say that I'm a young person, not an adolescent. I think I passed that threshold some time ago. Good morning, everyone. All my panelists are here, so I'll just give a brief introduction about them. I'll start with Paul Waweru, who is next to me here. He's a director at KNBS. I hope I have not. He's coming here, he's coming on our panel today to ensure that we get the right information. Why is data so important when we are investing in young people? Our theme for the day is ensuring we are investing in young people, especially informed through data, right? Director for advocacy and partnerships, if I'm not wrong, at NCPD, public education, PD, committed as usual to ensuring that we have the right information, and really just give us a brief an introduction to this with over 15 plus years of experience. Why data? Why now? Why young people and adolescents? Moses Mwema, who's a lawyer, the Nairobi representative, and also the current vice president at the current vice chairperson at the Youth Advisory Panel for UNFPA, bringing to us the information across the country. Why young people? He's representing a group of very vibrant young people who speak every day. If you follow their social media, that will give you an insight as to why. Next, the lovely Nicole, who is backed with her education and public health, giving us information.
But if I like say, I'm looking at the projections done from the 2019 census, and we are estimating the number of children joining class 1 or joining form 1 or joining university to be this number. Then there is something that we are not utilizing as data, the administrative data. We have a wealth of administrative data, but we are not actually using it to the fullest, and we need to start analyzing it and producing fact sheets so that they can be used by our implementing partners. I hope I've done justice.
Yes, you have. You have spoken about something very important, the utilization of data. what is there and what is not right now, and ask, is the data that is available enough, first of all? And she has highlighted some of those challenges. How are we working towards mitigating these challenges while ensuring again that we are not overcoming, or we are not, there is nothing we are living in the gray area as we go?
Thanks for the question. Post participation for those who are between 10 and 34. Post participation for those who are between 10 and 34. So from there, you're able to know how many are in the job market and how many are in school. Then there is the issue of the ICT usage. So we're able to know those who have access to mobile phone, those who own, those who have access to internet, and for sure the current generation is utilizing a lot of internet. So we're able to know how many have access to computers. Then there's the issue of disability. We saw in the presentation how many have various types of disabilities, the physical, either hearing or seeing. So I would say the data is sufficient. What remains is for us to maybe to disaggregate it further by maybe geographic distribution, so that you're able to see the disparities. Because when it comes to education attainment, there is no fair distribution in terms of that. So, but when we do the geographic distribution, we're able to see that. So maybe what could be lacking is maybe also issues like indicators like mental health. I think in most of the surveys we don't have that, and also probably the employment for the youth in terms of entrepreneurship. So that's what I would say. Thank you.
Thank you very much. I'll jump to Nicole, who your work mainly revolves around also helping organizations create programs, especially centered around young people. How is it you think that data especially can address the challenges of education, which is something I'm picking directly from what Paul has said? How is it affecting educational challenges faced by adolescents and young people? And how can we use it again to address employment or rather the employment opportunities for young people? How can young people use it to address the employment opportunities?
Thank you for the question, and thank you for the good introduction. Okay, so working with NGOs and these organizations, we go to communities, we collect data from communities. For example, in CSA, we have community sessions whereby we go to the community, talk to them, and get their data. Like, we collect data from them, we get information from them, and we use this information in various ways. For example, we find that in most parts of the slum areas, or for lack of a better word, most parts of the slum areas in Kenya, we have a lot of school dropouts. And the reason as to why they're dropping out of school mainly is because of drug and substance abuse. We have early pregnancies, we have early marriages. And when we look at the challenges that are affecting education in Kenya, most of these challenges are what I've just mentioned: early marriages, teenage pregnancies, drug and substance abuse. And we have data on teenage pregnancies and early marriages. But are we really using this data? For example, when we talk about the return to school policies for teen moms, yes, we have data on pregnant women or pregnant young people. Do we really use this data? Do we really go back to the ground and figure out how many pregnant young people gave birth and went back to school? Do we really follow up, or after we've just collected the data, we just sit with the data because now we have the data? What are we doing? Are our policymakers, after making the policies, are we ensuring that these policies are implemented? For example, we saw that we have data on young people who are involved in sexual activities. Do these young people have information on SRHR services? Are they being informed on, do they have information on things like contraceptives? Or do we wait for them to come back home get involved in sexual activities, and then we collect the data. I believe we should, when collecting data, we should start from the school level. Because these young people, as much as we are saying we should not teach them about sex and all this, I believe we should teach them on safe methods of having sex, because they are having sex. So when you are collecting, they're having sex. Even if you're saying, oh, if you go and teach a 15-year-old about having sex, it is wrong. It is not wrong, because when they come back home, they get involved in these activities. So I believe SRHR services should be extended to school level, age-appropriate HRSR services, S&H services should be extended to the school level. And when we look at this, when we educate them on such things, we find out that so many of them are able to protect themselves from such issues, and they are able to complete their studies. And when we're talking about employment, we have youth-based platforms. We have platforms on social media which enable people or youth to create self-employment. For example, you might find that a youth has just opened an organization in need of fellow youth. So this data, when we use this data, we are able to find out that when we collect data on the gaps, the employment gaps of young people, we are able to find out that majority of the young people do not have jobs. For example, the Gen Zs, we are in the streets. We do not have jobs. Why are we? We are very, we are very idle. We are just sitting.
Again to the next question. Moses, you are in a position of influencing and even decision making for a lot of young people as we know right now. How do you think that the data that is collected, is it really utilized in a way to benefit us as young people, especially the Gen Zs? I know we have some adolescent young people in the room right now. Is it benefiting them? And how is this data, how is it that us as young people, how can we get more involved in the data processing, collecting data, ensuring that also what role can we also play in this decision-making process?
Okay, thank you for that question and for the introduction. So I'll start first by just a pointer. It's very important that we reconcile the rooms. I've heard that there are vintage bodies and their bodies, so it's important that we speak as one voice. Okay, I think let's just talk about 2019. That was 5 years ago. We have seen so much data, so much on almost everything. There is nothing that I can speak about data that will be new. We have seen data on, including SRHR. Okay, then now we come fast forward 2024. What has happened? So I'll suggest an approach that maybe one can think about. 3 lens. The first one, to make sure that we have youth participating in almost everything. The first aspect is 1, partners. Are the youth partners in what you are doing? 2, leadership. Are they able to lead? Are they able to understand who is the leader? Are they able to appreciate the leadership positions? And the second one, the last one is the beneficiaries. When you come up with a program, who are you benefiting? If by any chance you want to benefit the youth, if your program, your project will engage the youth anywhere, you must have two checkpoints. The first one, are they informed? Are they informed of what you are doing, what you intend to do, what you have been doing? And the second one, were they involved as the beneficiaries? And were they involved or will they be involved in a project? So I think it's very important for stakeholders, for everyone, to make sure that those three aspects, that the beneficiaries, partners, and are the leaders, or direct or indirectly. I want to push away the narrative that youths want to be there directly. Okay? Yeah. The second one is, why is it important? The first one is accuracy and relevance. When you ask the youths know most or the best about themselves. Many organizations or many stakeholders have engaged the youth or have attempted to engage the youth, or others have just listed youths as a checkbox. When this happens, you have data or you have programs that is not accurate. Because when you call 100 youths, give them maybe a small amount. Yes, a small amount of maybe money or incentives. Yeah. Thank you for the question. Okay, so when you give them that, they'll just give feedback based on what you want. But when you involve youth meaningfully, you have data that's accurate and relevant. The second one is empowerment and involvement, ownership. When you have programs that are youth-led, youth active, proactive youth, you'll have programs that are very owned. The youth will own them, and you'll have no problem implementing them. The third one is accountability. Trust me, the youth, adolescents, they are very accountable. They will hold you accountable, and they will make sure that there's transparency. So accountability is very important and comes if you understand. Let me go back to a point of unemployment. An idle mind will feast on so much. When you have nothing to engage your mind on, you'll read almost everything. You'll understand, you'll start opening your minds to almost everything. So when you bring that aspect to accountability, the youth will hold you and will hold anyone accountable. And the last one is bridging the gap. I understand that in Kenya, there's been a generational gap between the boomers, Gen X, Gen Z, Alpha, and the millennials. So there have been that gap. So when you bring young people on the board, you are bridging that gap. You are closing that gap. And I'll be very happy when that gap is close to zero. Thank you.
Thank you. There is something you've said that I just want you to jump back into. You've talked about accountability and looking at it from a perspective of, as young people, we're requesting accountability from the government, from CSOs, from everyone else in the room. As young people, also, how can we be accountable? Especially when we're talking about decision making, as I bet you mentioned about young people being involved, but also them not giving maybe feedback that is true, but feedback that the person who's involved with them wants to hear. How can we as young people also ensure that we are constantly accountable when brought to these decision making positions especially?
Okay, to answer that, let me be selfish a bit and skip to UNFPA. So, the UNFPA, there's one thing called the Youth Advisory Panel. Yes, a panel is very important. And when it comes to informed decisions, make sure that this youth, I lead a very proactive group of youth, and we have come up with very amazing projects. Make sure you check them out. So, to eradicate this notion of maybe, let me say, fake data or imposed or pretentious data, for lack of formal words. So to eradicate this, we need people, young men, who are like willing or who are in sync with what you want. That's where the advisory panel comes in. The second one is youth-led surveys. I've talked about ownership. When you have youths participating in survey or being there or formulating surveys and running them, you'll have a sense of ownership, and the data that you'll have will be more correct.
Thank you. I'd like to go to Paul. We are in an era of technology and innovation. How is it that we are using this technology, especially in the wake of AI? How is it that we're using this technology in ensuring, as we collect data, how are we using it to maybe ease the work or even further our collection of data?
Okay, thanks for the question. And probably what I would say maybe is just to brief members on our role or our mandate as KNBS. KNBS is the custodian of official statistics in Kenya, and we're also the government principal agency for collecting, analyzing, and disseminating statistical data. So what we've done over the years, we've changed a lot, because initially we used to collect data using questionnaires, and then we would capture them. Then at some point, by the time we did, I think, the 2009 census, we were using the scanning technology. We would scan those questionnaires from the field. So you can imagine that time, the types of errors that were being introduced then. Then over the years, we've changed. We've come to CAPI technology. CAPI is computer-assisted personal interviewing technique. That has reduced the time that we've been doing. We've taken to disseminate that data, and also reduce the errors. Now come in AI, that's the artificial intelligence. So we've not adopted that, but we believe that by the time we do the 2029 census, we'll have adopted that. And there are some countries that have tried to use that. AI can be used to do a lot of work. My colleague has talked about ownership of data. Most of the surveys that we do, we utilize young people to collect that data for ownership. I can attest that. In 2019, we employed more than 150,000 Kenyans to collect the data during the census. Majority, maybe 90%, were youths. So I believe the data that we are using right now, they can own it. That's what I would say. So come 2029, I believe they'll also be used. And for those who took part in the 2019 census, there was a question on occupation. For occupation, that is where you're employed, you normally describe that. Then later, someone would come and code. But now, countries have come up with something that can be used to code that through AI. That's use of AI, automatically. The moment you describe that, then the system is able to assign a code to show you what's your occupation. Unlike when you are using humans or people to code that. So maybe the other area that we can think of, maybe we can adopt the use of predictive modeling. That way, you're able to forecast issues, then you mitigate before they happen. The Gen Zs that we have here, they use a lot of technology. They have their phones. And then there's something, I think you guys have seen what Google does. So if you Google something, the next time you visit the site, or if you have maybe in an email, they send you something similar to what you had searched last time. So they're able to check the frequency of what you search for, then they give you. And I think that happens also in Instagram and other social media. If you are reels, you watch certain types of reels, they are able to give you, they suggest you other reels. That's the use of AI. Maybe what it can be is what we can also think is, how do we use citizen-generated data? similar to what she talked about, that they collect data on their own. You know, for KNBS, we have the official data. Then we also have the citizen-generated data that is generated by non-state actors. That's NGOs. They have a lot of data. So if they have that data, they always come to us as stakeholders, then they engage us to ask us, how do we utilize this data to inform decisions? Thank you.
Thank you. Nicole, maybe also just the same question, but what are some of the modern technologies that you use, especially because you mentioned about collecting data? What are some of the modern technologies that you use to ensure easy data collection from your point as a NGO young person who is around? Yeah.
Thank you for the question. So for us, I work for CSA as a rover. So for us, we use social media campaigns. For example, technology is evolving. For instance, let's look at geographical data. We moved from paper maps to digital maps. I got here using Google. I just Googled the location of Sarova Stanley. I got here using Google Maps because I did not know where Sarova Panafric. Nope, Sarova Panafric is not well known. To me, that is. So I got here using Google Maps. And that is technology. So for young people at CSA, we use social media campaigns. For example, Twitter Spaces. You find that we have voting polls in Twitter. For example, when we want to find or to collect data on the number of people who have SRHR information, we might put a poll. If you have information, say yes. If you do not have information, say no. And this is technology, because we did not have this back then, but now it is available, and it is a way of reaching so many youth. Because if you look at the room, how many people are on their phones right now as I am speaking? I can see quite a number. Scrolling on TikTok, checking on Twitter, if kesho kuna maandamano, and all that. So I believe social media is one of the major technological advancements that is helping us collect data, because all youth, or rather, majority of the youth have access to social media, and it engages a lot of youth. And also, in our organization, we use called Kobo. Yes, I think it's Kobo. Kobo tool to collect data. For example, when we hold our community sessions, we are able to collect only the required data. For example, the number of people with disabilities present in the activity, the number of teen moms who are able to attend the activities, the number of boys, the number of girls. And in most cases, we find out that when we review this data, we are able to see that majority of men, or rather young boys, are not well informed about SRHR, because majority of them do not attend these community sessions, because sometimes we find that we are mobilizing for community session. Watauliza, kuna chai? That is what they'll ask. Are we being given something? If they're not being given anything, they will not attend, because they're saying we have to be compensated for our time. Also, Instagram. When we are talking about data, we can collect data from Instagram. We have majority of our organizations have Instagram pages. We can see that quite very few people are following these Instagram pages. For example, for instance, let's take a model. That's just an example. A model might have 5 million followers, while an Instagram page for like our organization, CSA, has less than 20,000 followers. This clearly shows how many people are actually interested and invested in the information that we are actually providing. I hope I have exhausted the question.
Yeah, maybe also maybe a call out to us as organizations. What are the kind of information we are tailor-making on these social media pages? Because if you're putting too much information that does not also relate to how the algorithm works, maybe it works against us most times. My next question will go to Lucy. what are some of the policy recommendations that you think we should start making as organizations, governments, young people, towards enhancing data-driven investments in adolescent and youth service, young people, especially in Kenya?
Thank you, Godano, for that question. What policies do we need to have in place? As Paul alluded to and as Nicole has alluded to, the landscape for data is changing. We are having data on social media, that social media is informing us that what will happen, is predicting what will happen, is to start to think without the box, throw away the box, the old school. We start looking at how can we utilize this data, policies, and looking at how do we get the young people where they are. I just want to quote the other week I was in Kirinyaga County, and the young people told us they have a Twitter space which has like 500 people that is drawn from Kirinyaga, and they meet in the evening on that Twitter space once a week to discuss issues that are affecting them. One week they are discussing issues of training, the other one they are discussing agriculture, the other one they are discussing their health. So we need to start looking at how do we utilize our social media to reach out to young people, and which social media. So we need to actually start interrogating where can we get these young people, where are they, and what is it that they listen to? How do we tailor-make their issues? But we can only do that if we work with them. By them, they need to lead. I remember sometimes when the youth parliament was very active, they used to say nothing for us without us. So it's getting the young people on the table, having a discussion with them in their diversity. There are those who are not in education, there are those who are teen moms, they have different needs. So we can't say one shoe fits all of them. So the policy recommendation is looking at the young people in their diversity and addressing the issues that face them. A youth in Mandera will be different from a youth in Mombasa or a youth in Nairobi. Their needs are different. So looking at these people in context. So we don't have one shoe fits all of them. So looking at what affects them, what is affecting the young teenage mother in Nyanza, what is affecting this teenage mother in Nairobi, because their needs are different. The ones in the informal sector, even within Nairobi, there is diversity. That young person who lives in Mathare is different from that young person who lives in Gumo. So their needs, looking at them holistically. That is what I would say. We look at these young people holistically and address their issues, but with them.
Thank you. Due to time constraints, I think that will be our last question to the panel, but also just as we continue this conversation into our different groups, into our different organizations again, we need to remember always that our landscape is changing on data. The young people, for our young people in the room, we currently have the platform, we have the mic, we have the voice. How are we also ensuring that we are ensuring policy changes that are going to last us into the 60 years the DG spoke about, that young people are going to be the largest group in the country? How is it that we're ensuring that right now is the time for us to ensure we are changing these policies that we need to change? How is it that we are participating overall from what we are doing? How is it that we are also holding ourselves accountable to ensure that as the diversity of things are shifting in our country, how is it we are ensuring that it's shifting for us and the next 50, 60 years continues to shift in a positive and impactful way that leads in our country into the change we all want to see it into. Thank you very much to my panelists for giving us allowing us to pick your brains in these conversations on decision making and investing of young people, especially in conversations of data. I'm very appreciative. Thank you very much. I have just realized I did not introduce myself, and that is such a letdown on me. My name is Godano Yusuf. I am the chair for the ICPD 25 Youth Coalition. been your moderator for the day. I'm going to be a shameless plug. Please follow us on social media pages at ICPD Youth. Thank you very much. Thank you. So I'll give it back to Robert. Thank you for having me and participating. If you have any questions, please, our panelists are still going to be around. You can still call, ask them, and pick their brains on conversations. Thank you.
Thank you, Godana. Let's give them another round of applause. A bigger one, please, a bigger one. Let's appreciate them. And as we get ready for the highlight of our event, I'm also going to be selfish and start saying that whoever is on X, please follow at NCPD on X, Instagram, NCBD, and Facebook. And we hope you'll have some conversations there as well. So please mark that on your browser. We are not going to collect fake data. So we'll start with some speeches. And our first speech will be from Pamela, who is from the Implementing Partners representative. And then maybe I'll reveal the others as we go. So please, Pamela, are you? Oh, thank you. Yes. Please come on stage and welcome Pamela. Please, let's give her a round of applause.
My name is Pamela Onduso. I'm the country director for Pathfinder in Kenya. We're strong supporters of all things to do with adolescents and youth, particularly looking at issues around reproductive health. I've been given 2 minutes as a vintage buddy. I'm a mother of a Gen Z and a millennial. I've been given 2 minutes to talk about how we are using data to reach young people. We recognize as an organization in Kenya that there is a gap in terms of provision of services to very young adolescents, so the 10 to 14-year-olds. And therefore, we attempt through behavior change communication programs, through life skills, through peer-to-peer efforts, and self-care approaches to reach young people so that they can avoid issues that make them vulnerable or at risk, particularly issues around gender-based violence, issues around early marriage and unintended pregnancy. And we're strong believers that it's not just the girls who need to be in school. Kenya has a unique problem. We need to also advocate for the boy child. We believe also in the role of parents and caregivers. Where we have programs, we engage with parents, teachers associations. We encourage them to look at issues around not just education, but also mental health, and also communication with their young children. In the area of sexual debut, because we know that sexual activity in this country, and this booklet that has been produced shows it very clearly, it starts before the age of 15. And so we are very, very keen, and we support groups like the UN system and UNICEF in particular, who keep girls in school. That is a social vaccine. It's extremely important to do that. And also to focus on life skills and sexuality education in partnership with the Ministry of Health and the Ministry of Education, and working closely with groups like the National Council for Population and Development and the gender teams to advocate for keeping our young people in school. With respect to poverty levels, and particularly multidimensional poverty, hongera to the government of Kenya for its work around technical and vocational education and training. Excellent. That's the way to go, because we have so many young people who are dropping out of school very young. But together with that, combine it with life skills education and economic empowerment. Opportunities for the young people to actually generate income. I'd like to make a pitch, shamelessly, for generational diversity. Hello, young people. Equity and inclusion. And we do believe in intentionally seeking to include young people in employment. As country director at Pathfinder, I was hired as a young person straight out of college and mentored. And so, as a rule, more than half of the staff in Pathfinder International, you're welcome to come see us, check us out, are young people of both sexes. Okay? And then we also make an effort to hire and empower orphans and children made vulnerable, whatever the circumstances, and persons with disabilities or persons differently abled. I think the last thing I'd like to talk about is the use of social media. The young lady from CSA spoke so eloquently about the need to work on Instagram, with X, and others to reach young people with messages on antenatal care, postnatal care, baby immunizations, contraception, and so forth. And we do this as an organization. So with those few and many words, I say thank you, and thank you, young people, for honoring us with your presence. Thank you.
A big round of applause, please. And now we shall invite Dr. Shaheen Nilofa, Country Representative, UNICEF Kenya. Encourage her, please, as she comes.
A very good morning to all of you. I'm sure it's still good morning. It is? All right. It's good afternoon. Okay. Dr. Mohammed Sheikh, the Director General for NCPD, and Mr. Timothy, who's just walked out, Economic Planning Secretary, Mr. Paul, my colleague from UNFPA, a colleague from Pathfinder, the Country Director Pathfinder, and all the young people and adolescents and millennials and Gen Z present in this room. Very much happy and delighted to see a diversity in this room that we have seen. And I was very much also equally happy to see the panel discussions, which ranged a lot of issues, including a moderator from ICPD. Everybody talked about, so what? Data is important. What's next? And what do we do from here? And where do we go from here? So there are very valid feedback that we've heard from the conversations from the previous session. And I think the theme talking about how do we use evidence is ensuring that it's an informed our investment in adolescents and young people. And I quite liked what the DG's opening remarks talked about, the transition from child population gravitating towards a more youthful population is the reality. In about 10 years to 50 years down the line, the continent will see an upsurge in the number of young people. So therefore, we need to really invest in today to ensure that tomorrow is really, we're well prepared for tomorrow, ensuring that everybody has a shared prosperity and, and the decision making, decisions that matters to everybody is really being backed by evidences and data. So therefore the systems, the institutions, the enabling environment, the regulatory factors, they must all speak to the reality which is confronting us tomorrow. So we are also transitioning from what we call is allocation towards investment. We cannot necessarily be talking about what's the allocation for the year. We should and must talk about what is our investment that will pave way for a more healthier, a more quality future for tomorrow. So, distinguished ladies and gentlemen and young people and adolescents in this room, we are talking about the Africa's youthful potential. We're talking about our tomorrow, but we cannot necessarily ignore our today to speak about tomorrow. So as we know, Africa has the youngest and the fastest growing population, and the evidences are soon going to stare at us. And the continent's workforce projected to surpass China and India, where I come from, in the next decade. And this is what the projections look like. And when policy experts talk about a demographic dividend, which everybody is talking about, we might think about that when we talk about policy makers and the decision makers often talk about a spreadsheet and what the spreadsheet looks like from now until the next 10 years of a time frame. But what we're talking about, how do we convert these demographic dividends into an opportunity? And so from a point of view of an opportunity and investment scale point of view, we really need to see that how the planning should be able to help and move towards going forward. So the evidences that we know that are clearly showing, and we also saw from the presentation that was made earlier, the value of investing in adolescents, education, health, well-being, and agency. We also heard about 2.5 million children who are currently out of school in Kenya, and that number is only growing. So if we get this right, we have a seismic opportunity for sure to address the inequality now and for the decades to come and for the next generation. So 1.2 billion adolescents, which is about age 10 to 19 worldwide, and 90% of these people in low and middle income countries are really a major constituency that we cannot necessarily afford not to think about it. And investing in adolescents contributes to economic growth, improved governance, and in achieving SDGs. So a defining period marked by rapid growth that we've seen in identity formation, as the DG also spoke about, as we transition from LMIC to middle income country, hopefully in few years' time, it is crucial period for a developing individual identity when young people are figuring out who they want to be and what they want to be in the world. So positive relationships leads to better outcomes, as we all know, and it also enhances a feeling of inclusivity. Negative experiences, of course, increases fear, self-doubt, and we heard from the panelists from the CSA speaking about it, and social isolation can have a very long-term impact. So what is therefore important is the support from families, policies, and services that is very crucial for development of their full potential. And UNICEF's commitment, as you know, is the 70 years of addressing children's urgent issues becomes all the more very apparent. Today, more children are surviving to the 5th birthday, which is a good news. And we've also seen the KDHS report showing us some incremental progress over the years. And enrolling in primary school are increased more than ever before. And UNICEF has been programming with and for adolescents. We spoke about it's not just enough to talk about how adolescents and young people are part of the data, but it's also important how do we engage and ensure their participation in forming the decisions moving forward. So therefore it's become very important for us when we program with adolescents, we need to really listen to them, we hear them, and for many years addressing adolescents' development largely through education, through our sectoral program, whether it's education, HIV, prevention and treatment, nutrition, water, sanitation and hygiene, and social and child protection initiative. So it's been in a way looking in the sectoral part of it, but I think its time has come. We cannot necessarily divide or fragment the life cycle into different sectoral programs, but to see it from a holistic ecosystem, so how they interplay with each other. We spoke about in the earlier session about the potential, the untapped potential of the Gen Zs. And the Gen Zs are already, and as we've seen it in the recent weeks and the month, are transforming and improving communities, but the full potential of these powerful demographic is still untapped. Only a quarter complete upper secondary school. 60% of unemployment are aged 15 to 24. Girls are more likely to miss out on education for various reasons, obvious and otherwise. Girls face higher rates of adolescent pregnancy, maternal mortality, child marriages, HIV, and gender-based violence. So Kenya's adolescents face a skill gap, which is also too very apparent when they try to enter the job market. If they don't have the necessary skills and the employability to be able to compete in the market. And there are, of course, issues of mental health, which is also evident in the presentation, increasing concerns to all parents, to service providers, to policy makers, and the young people themselves. So how do we engage adolescents? It is therefore very crucial to acknowledge that just because everyone in this room are very young ones, and I wouldn't say the old days, adults' experiences differ from today's youth, right? And the technology and career parts that we spoke about, how do we have innovations including the AI and other digital spaces, ensure that it's not just the traditional old spaces, but try and look around the other templates of the digital spaces and other formats that the Gen Zs are very conversant with and the young people are very conversant with, necessitates continuous learning for us as adults. So there's already a mismatch between skills taught in the school and those valued by the labor market. New generations need to continuously learn and adapt and to survive in the changed climate as well as in today's move fast and break things digital world. 11.6 million adolescents in Kenya, which is about 22.2% of the total population, need meaningful engagement and program designs that must reflect the perspectives. So therefore, the challenges and opportunities that we have in front of us, for too long, adolescents have been sidelined from processes and decisions that affect their lives. So I think what was also said, that don't use it as a capital, as bankable thing, but actually have a meaningful engagement. And we have this, they have been overlooked by institutions, by donors, by governments, by society at large for far too long as well. They are stigmatized because of their age, where program designs assume they are too young to hold an opinion, and we've seen that they have shattered that myth. And UNICEF is directly funding youth-led networks across the region through the joint UN together with UNFPA, 4SR HR program, and thousands of young people are participating in what we call is Generation Unlimited, which is about engaging young people by providing them skills, by providing them entrepreneurship, and providing them the seed capital so that they're able to take things, moving forward, because not everybody would have an opportunity to get a job in the formal spaces. So in short, I would like to say that the support for adolescents, UNICEF also supports the Ministry of Health and counties to increase access to adolescent-friendly HIV safe spaces and services. The result of our collaboration is the Adolescent and Young People's Reproductive Health Policy, which is 2024-2030, National Social Behavior Change Strategy for Adolescents and Young People's Sexual Reproductive Health. We look forward to supporting the implementation of this policy and others which may impact the areas of life, the adolescents' life in Kenya. Millions of adolescent girls and young women have been vaccinated across Kenya to protect them against the HPV, an overlooked infection which drives 95% of cases of cervical cancer, which is leading cause of cancer deaths among women in sub-Saharan Africa. We are hopeful through engagement of all the stakeholders, including the religious institutions, the policymakers, the community, influencers, that we would be able to increase the number of young girls having an uptake of an HPV vaccines. I'm proud to be a part of this launch event today, as you know, which showcased the situation of adolescents in Kenya in 2024, which we have been working very closely with the KNBS, with the National Council for Population and Development and UNFPA. We are here to discuss about how do we embrace data, but more importantly, how do we utilize the data for a more meaningful programs and policies that forms and shapes the strategy for young people and adolescents going forward. The Senate, as we speak, is currently discussing a bill on provisions of sanitary towels. This is a laudable intervention that will most likely benefit adolescent girls, and we are closely engaging with this committee, ensuring to provide some inputs and feedbacks that will be taken into consideration. And we hope and believe that this is the most important, one of the most important element which will ensure that the girls to continue their education beyond primary and secondary. Distinguished guests, ladies and gentlemen, young people and adolescents, we welcome this opportunity for a policy conversation on how to strengthen adolescents' engagement and voice that matters most for national importance, and especially those that concern, because Kenya's future and the continent's future lies in the hands of the youth. Asante sana.
Okay, thank you. Thank you, Dr. Shaheen. The next person who is going to speak is a gentleman who wears two hats. Let me tell you the hats he wears. He is the International Operations Manager, and he is also the officer in charge, UNFPA. Please welcome Mr. Paul Makwinja.
Mr. Timothy Gakuo, Economic Planning Secretary. Mr. James Kimonye, Board Member, NCPD. Madam Leah Chichiri, Board Member, NCPD. Dr. Muhammad Sheikh, Director, NCPD. Dr. Shaheen, UNICEF Representative to Kenya. All heads of government departments and agencies, representatives of partners present, all protocols observed. Ladies and gentlemen, I'm pleased to join you in celebrating this year's World Population Day, focusing on embracing the power of inclusive data towards a resilient and equitable future for all. Our specific focus in Kenya is on investing in data on adolescent and young people. This segment of the population is particularly important as they are more often than not vulnerable to sexual and gender-based violence, teenage pregnancy, HIV and AIDS, and harmful practices such as FGM and child marriages. Some of these challenges affect the education and health of an entire generation, adding to the cycle of poverty. When data from the most vulnerable is not prioritized, true progress is not realized. Globally, evidence shows that places across the world with the poorest data quality on adolescent youth mothers aged between 15 and 19 are the regions where adolescent childbirth is most common. For humanity to progress, people must be counted wherever they are and whoever they are, in all their diversity. To go uncounted is to be made invisible, and as a result, left unserved. This contributes to a 10-year-old girl being left with no health care when she's displaced during a conflict, or another woman with a disability having no safety net when a crisis strikes. It leaves a newborn baby in a remote community without the passport to protection that birth registration confers. Over the last 3 decades, heeding the call of the 1994 International Conference on Population and Development, societies around the world have made tremendous strides in improving population data gathering, analysis, and use. New population numbers, disaggregated by age, ethnicity, gender, and other factors reflect the diversity of our societies. To take just one example, approximately 2/3 of countries, Kenya included, now include questions on disability in their censuses. Let me take this opportunity to commend the government of Kenya for ensuring that the population data collected is disaggregated by demographic, geographic location, and the groups furthest left behind. Advances like these have improved the delivery of health care to people all over the world, resulting in significant leaps forward in sexual and reproductive health and the ability to exercise rights and choices by women and girls. Even so, the most marginalized communities are still underrepresented. And as a consequence, this deeply affects their lives and well-being. Recent UNFPA research reviews acute and growing inequalities within and among countries. In too many places, for example, globally, women from racial and ethnic minority groups are nearly invisible in statistics tracking maternal deaths. Many data collection tools neglect adolescents below the age of 15, and therefore leave no evidence to inform decision-making. This is one reason why health and social services overlook their needs. This year's World Population Theme, Embracing Data for Decision-Making in Investing in Adolescents and Young People, provides us with a moment to ask ourselves, who is still going uncounted, and why, and at what cost? It is also a moment for all of us to commit to doing more to ensure that our data systems capture the full range of human diversity so that everyone is seen, can exercise their human rights, and can reach their full potential. In Kenya, more data on population within humanitarian settings, arid and semi-arid areas, as well as data on adolescents, need to be collected, analyzed, and utilized in making developmental decisions. As we mark 30 years since the International Conference on Population and Development held in Cairo, there is much more to be celebrated, but still much work to be done. To realize the rights and choices of those pushed to the margins of our societies, we have to count them. In conclusion, UNFPA remains committed to working with the government of Kenya and partners in strengthening the national and subnational data systems to ensure everyone is counted and accounted for in pursuit of national development. Distinguished guests, thank you very much.
Thank you. Now I will call upon Dr. Mohammed Sheikh to lead us to the next stage. Karibu Daktari.
Thank you very much. Tumpigie makofi hapa tafadhali.
So for those Gen Zs who are here, the government has a protocol. So the protocol is that whenever the PS want to speak, the senior most person in the government must invite the PS. So that this you understand the protocol of the government. Sindio? Hata kama ni Gen Z, sindio? Very good. First and foremost, I want to thank our panelists our keynote speakers from UNICEF and UNFPA for those remarks. We just have 2 more presentations from our chair and our EPS, and then we'll just end this session. But mine is just to thank them really for those wonderful presentations and remarks. I just want to, we say this event is an event that we have so that at least we create awareness on issues on population and development. And I hope what we have covered here probably has given you some hints on the issues that are concerning about population. Sinivo, mwelewa kidogo, si ndio? Especially the issues of the adolescent and the youth. When you look at that adolescent, the age of 10 to 14 is an area that is really, we have a gray, that's a gray area. Because if you look at even our indicators in the Ministry of Health, in any institutions, there are no indicators specifically for that age group. Even when they're doing surveys, we don't have indicators for that age group. And then from 15 to 19 is another age group. And then 19 or 20 to 24 is another category. But the one really which has always been left out is the one at 10 to 14 years. So I think is important to capture. But something I want to share with you is that we are talking about data, we are talking about digital information. The world today is concerned, or there are issues that there are a lot of information. Sindio, right now you can get the breaking news from your phone, isn't it? But there's also a lot of misinformation and disinformation. And which is causing in the world, the concern today is that it's causing a lot of polarization in the world. So the information you get must be reliable, must be government static, and that's why KNBS is the government, is the national, is the official statistics holder. So that any data that comes from KNBS is the one we use for any decision making. And the other one I think is about the demographic shift we talked about this morning. That our population is moving from child-based to adolescent or youthful population, and has consequences, but it's us to understand what are the need of this population. Our representative, Madam Shalin, talked about the skill match, that many Kenyans are taking, certain skills, but those skills are not matching with available jobs. So it's important at least also to identify what kind of studies you need to do so that at least you also know what is there in the market. And I think the last one is about how we can harness about our human capital, and our human capital index those are the things I think also we need to discuss in this forum. For those of you, I want to invite our chair. Our chair is called he's a retired General Karangi. He was not able to join us today because he had other engagement somewhere. So he has delegated this to our board member who is here. He's called Mr. James Kimonya. So I want to invite him to make remarks on behalf of the board. NCPD is run by a board and also by management. So karibu, Mr. James. Karibu sana. Tupige makofi tafadhali.
The Principal Secretary, Minister of Economic Planning, Department of Economic Planning, represented by Timothy Gaku, who is the Economic Planning Secretary. Dr. Sheikh, our Director General, who has just spoken to you. We also have another board member here, Leah Churchill. Just wave to the crowd. It's my colleague in the board. They're very, let me say, good partners, as they have spoken here today. First was Pamela Oduso, the Pathfinder Country Director. Shain Nilofa, Country Director, UNICEF. Paul Mukwinja, International Operations Manager. Other government representative present, and many of the other partners who are listed here, and they have not been mentioned, and the civil societies and the invited guests. Ladies and gentlemen, good morning. Good afternoon. My name is James Kimonya, as you have been told by our Director General, a member of the board. And I'm here to represent our chair, who is not available today, General Retired Julius Karangi. It is my pleasure and honor to welcome you all to 2024 World Population Day celebrations. And the board, or the council for that matter, and the staff appreciates that you have spared your time to join us as we commemorate this great day. The council is committed to advancing the population development agenda, which emanates from its mandate, which is research and analyzing on issues and development policies relating to population, and providing leadership, mobilization of support for population programs, including their coordination and implementation by different organizations. Also assess the impact of population programs and make recommendations arising from such assessments. They also identify and advise on population issues that may not be adequately dealt with by the government. The coordination of the implementation of population and development activities being carried out by various stakeholders in Kenya. And finally, as a focal point on all matters relating to population and development policies and programs in the country. Ladies and gentlemen, the 2024 World Population Day theme, which is embracing data for decision making, and we have gone through that in a very detailed way, using evidence to invest in adolescents and young people. Is it at the heart of the NCPD as we use data as evidence to advance the programming for adolescents and young people. The council has been at the forefront as a population data producer and a user, especially in development of policies, programs, and materials. The council utilized data in the development of the sessional paper number 1 of 2023 on Kenya population policy on sustainable development, and the State of Kenya population reports, annual demographic dividend implementation reports, and ICPD 25 Kenya commitment reports. Policy briefs and advisory papers, just to name but a few. The council has prioritized and mainstreamed the triple threats of adolescent pregnancy, HIV and STIs, and sexual gender-based violence in its policies, programs, and activities. Further, in looking beyond the numbers, the council has partnered with the Kenya Commercial Bank Foundation to support teenage mothers from poor background to return to school by providing scholarships. In addition, the council is committed to continue conducting research, analyzing data, and advocating on issues that hinder the adolescents and young people enjoying quality life. As I conclude, ladies and gentlemen, I wish to appeal to all our partners to put the adolescents at the forefront in their programming. Thank you, and may God bless you.
Tumpige makofi. See, you know he's my employer, so you must clap for him again. Good. So we are at the end. And before we hear from our chief guest, our PS was supposed to be here this morning, but because of, in fact, he had planned to come here. And I know Mr. Timothy will talk about it. But the last minute there were other assignment that came up. Is there any person with any question, any concern? Have we met your objectives this morning and this afternoon? The objective was just to sensitize you on population matters. Can you say when you leave this room you are sensitized on population issues? The key concerns for our nation? Please, if you have I know there's our population policy which we are going to share with you just outside there, you get a copy. and you will see the key issues on population matters. So at this juncture, we take this opportunity to, kuna ile watu ya jinsia wajui, sisi watu ya Kandu tunakina kitu kunaitwa nyayo. Siku hizi mko na gani? Siku hizi nanguka naya? Hapana. Wacha tuwapatie ile ya nyayo. Si ni sawa? So tunapiga ile ya karibu, si ndio? Moja. So Mr. James Kago, please welcome and make remarks on behalf of our peers. He is our economic planning secretary. He's also my boss, and I will do these remarks on behalf of the peers. Karibu sana.
Good afternoon. Good afternoon. Yes, Dr. Julius Karangi, the chair NCPD, who is ably represented in this forum. Sheikh, my friend, the Director General NCPD. Of course, Director Rea, always a friend in the ministry. Director, of course, in the board. Dr. Sahin, Country Director, UNICEF. Mr. Paul Mukwanja, is it Makwinja, International Operations Manager, UNFPA. Senior government representatives, development partners, civil societies, guests, youth, Gen Z, and everybody else. Good afternoon. Before I read the PS speech, I just want to remind myself that I'm working on this podium on delegated responsibility by my PS, Mr. James Mohati, who actually is away somewhere else doing other serious business of government. And he ably requested me that to come and basically officiate on his behalf at these celebrations marking the World's Populations Day. So you know, as per the protocol, when you read the speech of someone else, you don't earn any single one. So I'll take the liberty of making one or two comments before I read the speech. We are here about data. The DG passionately always says data informs evidence-based policy development, policy formulations. And again, from the presentation this morning, from the presentation that has been made to us, the primary focus of today is about youth. Why youth? Is because they constitute more than 75% of the Kenyan population. And then actually I heard about some terminology and connotations about youth, vintage today, and what advantage, yes. And I remember actually, I think way back in 2010, I attended an international forum in Addis Ababa that actually had the presence of former presidents across Africa. And one of the key ones was Obasanjo, you know, Obasanjo, former president of Nigeria, who said actually in this particular forum there are two categories of participants. But one common denominator is that everyone else is a youth. You are either current youth or a former youth. The question is, as we reflect, I believe each one of you come from a family, and of course this morning you purpose to come to this commemorations of the World Population Day. And I'm so sure actually some of you are saying you used Google to locate Pan Africa Hotel. Some of us just drove from our offices basically to come here. But the question is, why are we here? Why are we here? I think the issues about the youth are basically in our minds every day. Yesterday night, I was following what's happening in the USA, and they are saying currently the Gen Z, in terms of registrations to vote in the coming US elections, the numbers have increased by 700%. So you can see the revolution basically across the world. DG and everybody else, the question is, how do we invest in critical components, critical ingredients to earn the trust of the youth? We can make statements, we can talk about data. The question is, what level of investments do we need to make to earn the trust of the youth? In my river of life, which is big, the river of life, as you know, every river has a life, and every river has clear characteristics. You see a fall, you see a gorge, you see a waterfall, you see a meander. Those characteristics defines as a human being. In my river of life, between 2009 and 2014, I was the director of youth affairs, based at Kenco. But I'm sure I don't know how I became a director of youth affairs. 2010, I was the chief economist. Called implementation of the economic planning function at the ministry and mainstreaming the development agenda in the Ministry of Youth. 2010, around one Saturday afternoon, when I was in my schedule relaxing, I got a call from the PS. That time, Martin PS said one thing for youth, which happened obviously to have been the Minister of Devolution and Planning. And the PS called me and says, where are you, Mr. Akko? I said, I'm in the center. He said, okay. I have aligned the delegation of youth in my office at Treasury. And they are saying they're not going to leave my office unless I make an appointment for you to become the director. What is it that you have done to the youth? I said, yes, I'm shocked. I said, I don't know. You say then what I'm going to urge you is, please take a vehicle, the nearest vehicle that you can be able to manage. Make sure that you are in the lobby before 8 p.m. So around 8:15, I was actually at Treasury. The youth were there, I think around 200 or so, but the senior officer was in the office. When I moved the PS, he told me now, look at this. These were members of the National Youth Council. They represented those youth who were basically downstairs. And I've taken my liberty and discretion to the PS to sign a letter making you the director of affairs. So I served that document between 2010 and 2014. That is one incident in my river of life. 2013, another incident happened. After the classes, remember, I don't know if I got to remember, there were classes in Ramu, they were on Pegatoni. They were very excited. Who were directed by the president, who Kenyatta, that the youth, the National Youth Council, was actually going to visit Ramu and emphasize the youth in Ramu. So the decision was made to take around 500 youth to Ramu. And the question was then, how did we further the youth to Ramu? So a decision was made now actually to lease some aircraft to AWS to take the youth to Ramu. Obviously now, we can only manage 2 aircraft. They cannot carry them anymore. Then finally they agreed. They said that's okay. So one Sunday, around 10 at night, we are now working on the modalities. Who should actually go to Ramu? Myself, that time actually I was enjoying my dinner in my house with my family. And I remember actually the peers at around 9 says, Director, we have a problem here. The youth are here. They are saying they have to go to Ramu. But that's not the issue. They are saying they cannot board those aircraft. If it means risking NYS buses to go to Ramu, so be it. But then there's one condition they have put before us. That now, it was the meeting chaired by Waigoro, who is basically the current governor of Kenyatta County, saying, we are not going to get into any buses unless Mr. Yaku is part of us. We left Treasury at around 3 a.m. in 5 buses for NYS to Mombasa. From Mombasa we went to Marindi, and from there we drove on the road to Mpeketoni. The question is, what is it that we need to do to earn the trust in the youth? I know there are policies in terms of how best can we go to integrate youth in decision making. And that's the reasons why National Youth Council was established. I was very excited actually, I think this week, when the president was in Mombasa and he applied his mind to what you call now the energizing the National Youth Council. And he invited actually youth, the Gen Z, to actually visit and be able to engage and see how best are they able now to move forward on matters of National Youth Council. How best then do we invest our minds in getting this trust of our youth? And that's the questions that every one of us in this room need to be asking ourselves. You don't have to have the youth with yourselves. How do you invest in their trust so that anything that you do, they are able to trust that you are doing it for their greater interest? I think it doesn't matter. All of us, I think, in the position of responsibility, it doesn't matter whether in a community, welfare organizations, it doesn't matter whether you're in the church leadership, it doesn't matter whether you're a leader. You really have to invest to get the trust of the youth so that whatever we do, we know is for the posterity and the greater good of this country. I thought I need to be able to say this because we can make statements, I can read the speeches, but that will never change the reality that we need to invest. We need to invest and get that what you call the dividend that's expected from us. This is a gentleman then allowed me to read the speech of P.S. Mohati. Basically, as I said, I'm here on delegated responsibility. Good afternoon, ladies and gentlemen. Good afternoon. Good afternoon. I'm honored to join you today as we mark the World Population Day 2024. The World Population Day seeks to focus attention on the urgency and the significance of population issues. Actually, when I heard about sexual debut, I was asking myself, what is this sexual debut? I was struggling until the presenter made a clarification. I was asking myself, where do I fall? Those things. Well, where do you fall under that category? Keep on asking myself. The commemoration of this day was established by the Governing Council of the United Nations Assembly in 1989. In the December 1990, the United Nations Assembly passed the resolutions to celebrate the World Population Day on the 11th of July annually. The first World Population Day in Kenya was celebrated on the 11th of July 1990, and 9 countries participated. This year, ladies and gentlemen, the World Population Day emphasizes on the creation of the awareness of population and development issue to strengthen the capacity to utilize and communicate the population data and evidence such findings to policymakers like ourselves, development partners like UNICEF and UFPA and everybody else, and program implementers at all levels of government. Now, key specific objectives of today's World Population Days are: 1, raise awareness on available evidence on adolescents and the young people's achievements, challenges and opportunities for scale-up. Number 2, strengthen and support the multi-sector collaboration to address issues affecting adolescents and young people's development as envisaged in the Kenya Demographic Dividend Roadmap for 2020-2030. And number 3, to disseminate the Kenya population policy for sustainable development, which guides the population programs in the country. Ladies and gentlemen, the World Population Day resonates well with the session paper number 1 of 2023, last year, on the Kenya population policy for sustainable development, whose goal is to attain a high quality of life for the populations of Kenya that is secure, healthy, broad educated, trained, and empowered for sustainable development. Those attributes defines the Gen Z generations. The session paper has 6 thematic areas, namely: number 1, population size, growth and age structure; the fertility, morbidity and mortality; mobility, migration and urbanizations; populations, human settlement; environment and disasters; and finally, data research and innovations. The thematic area on data research and innovations, ladies and gentlemen, is aligned to the World Population Day 2024 theme, which is embracing the power of inclusive data towards a resilient and equitable future for all. The theme reflects the outcome. The theme reflects the outcome of global, regional, and national evaluations on progress and achievements attained in the implementation of 1, The 1994 International Conference on Populations and Development Program of Actions. 2, the 2013 Addis Ababa Declaration on Population and Development. 3, the 2015 Sustainable Development Goals, among other commitments. Kenya, on its part, ladies and gentlemen, the global theme has been domesticated as embracing data for decision making, using evidence to invest in adolescents and the young people. Kenya corrects analysis that disseminates data on population development to inform policy programming. Examples of the primary data sets available include the Kenya Population and Housing Census, the Kenya Demographic and Health Survey, the Quarter Labor Force Service, the Kenya Integrated Household and Budget Service and Economic Service. We are also aware the Kenya National Census of Schools is basically underway, courtesy of the Kenya National Bureau of Statistics. Further, the country has a wealth of administrative data, such as births and deaths, health education statistics that are corrected, well-guided services, and which inform decision-making. In the 2019 Kenya Populations and Housing Census report, the population stood at 47.56 million. It is important to know that 35.7 million, which represents 75% of the populations, were persons aged below 35 years, completely compliant with what we call the youth policy, which defines youth between the ages of 18 to 35. A mere 25% of the population represented persons above 35 years. I think that's where DG and ourselves, advantage, that's where we belong. That's where we belong. However, by 2030, it is projected the populations below the age of 35 years will be 40.4 million, translating to 69.8% of the total populations. The proportion of the population above 35 years will be 30.2%. This, therefore, ladies and gentlemen, this, therefore, calls for better planning of all segments of the populations, taking cognizance of the changes in demographic profiles. The above notwithstanding, as we commemorate World Population Day today, it is important to use data for evidence-based policies and program development for adolescents and young people. The adolescents and young people that are aged between 10 to 24 years were enumerated as 16.1 million in 2019 and are projected to grow 17.7 million by 2030. This group of people faces major challenges. We could, number one, and this has been amplified at length since morning, teenage pregnancy was reported 15% as per the 2020 Kenya Demographic and Health Survey. Low awareness of HIV with 4 out of 10 girls, 3 out of 10 boys aged between 15 to 19 having ever tested for HIV. As per for HIV estimates of 2023, there were 1,215 AIDS-related deaths among adolescents aged between 10 to 19 years. The prevalence of gender-based violence, with more adolescent boys experiencing physical violence, 26.1%, compared to girls, 16%, while more adolescent girls experiencing sexual violence compared to boys at 1.8%. Ladies and gentlemen, lifetime use of drugs. Lifetime use of drugs, substance abuse among adolescent people between 15 to 24% was at 10.1%, and lifetime use of tobacco was 7.3%. DG has amplified this particular point. Last week I was having discussions with my teenage relatives, and one statement came out very strongly. They said, "Uncle, what you may not know, all of us at our age, at one point, we have experienced marijuana." I was shocked, because they know my stand about marijuana. They say, "You may not like it, but through colleges, we've been able to experience marijuana. Now, how do you get ourselves out of it?" This is the reality of the issues that we must be able to confront it. Persistent unemployment, we stood at 25.5% for persons between age of 15 to 25 years. I think we need to purpose, in everything that we do, we must purpose to create jobs. Ladies and gentlemen, it is worth noting that the fourth midterm term plan 4, in line with the Kenya Vision 2030, policy framework prioritizes investment in health, education, employment, and governance structures to optimize benefits for the youthful demographic structure. A stipulated MTP4, which is the country national plan, the government has put in place the following measures to address challenges faced by adolescents, young people, and youth. But I would say this is not enough. One, adding the triple threat of teenage pregnancy, new HIV infections, and gender-based violence through multi-stakeholder engagements, and having a commitment plan to guide these implementations. Number two, implementing 100% transitions for basic educational provision of capitations for technical and vocational education and training, development and implementation of national guidelines on alcohol and drug abuse, real implementation of the national guidelines on alcohol and drug abuse, creation of employment through various programs, including Tarenta Hela program, Kenya Youth Employment and Sustainable Accelerator program, access to government procurement opportunities, that is AGMO, and so many others. Establishment of the various funds, financial inclusion funds, like Youth Enterprise Fund, WESO Fund, Hustler Fund, Women Fund, but identifying the clear pathway trajectory to ensure we're able to guarantee value for investment in these particular funds. Setting up 200 digital hubs in the TVETs and Technical Training Institute across the country to increase internet access for job creations. The government, this is a gentleman, is committed to providing timely, credible, reliable, verifiable, comprehensive, well-segregated and georeferenced data for programming. In addition, the government is in the process of embracing digital innovations such as cloud computing and big data to avail data in real time on populations. As we conclude, it should be noted that data alone cannot tell the whole population story, cannot tell the whole population narrative. Data mostly reduces people to simple statistics, reinforcing stereotypes, biases, and stigma. Let us have a look beyond the numbers as we develop various programs, to address the issues that we know, among adolescents and young people. Finally, I wish, therefore, to appreciate National Council through, of course, the chair and the DG, National Council of Population and Development, for actually taking and championing this read and provide the guidance and implementation of the population programs. Kenya National Bureau of Statistics for providing the necessary data, UNFPA, UNICEF, World Bank, and every other partners for the continued support in every way. Other government agencies and civil society organizations, and the youth of Kenya for implementing population programs. Let's live with the theme of embracing data for decision making throughout the year. Mungu awabariki.
When the chief guest speaks, the function is done, isn't it? So now we are at the end. I just want to take this opportunity to invite our board member to give a vote of thanks. But before that, I want to really thank you all for really coming on board and participating in this event. You can go to our website to access all that information, especially the situation analysis, I think will be loaded, and the other information from NCPD. So from my side, I just want to say thank you very much, Karibu Director, just to give a vote of thanks, and then we'll close with a prayer, and then that's the end of the function. So, Karibu. Tupigie makofi tafadhali, Director.
Thank you very much. Good afternoon. Yeah, I think I want to use 2 minutes just to appreciate all those who have participated in this particular event. So let me start by thanking our Almighty God for giving us this wonderful day. I know we plant, but it's the one who has enabled us to undertake the activity. Number 2, let me appreciate as the board and the National Council for Population and Development, the guest of honor, our Principal Secretary, Mr. James Muatir, ably represented by our Economic Planning Secretary, Mr. Kakuo, for delivering such a wonderful speech. Number 3, let me thank and appreciate Madam Charlene Daktari, UNICEF representative, Mr. Mukwanja, the UNFPA, for honoring our invitation and delivering a wonderful speech and the support you have provided towards this day. We do believe as NCBD, we may not have been in a position to organize, to host this meeting, but because of the support from those two institutions, we are here today and the event has been very successful. Number 4, we are grateful to our implementing partners, those who are in this room. I know there are those ones who are not in this room, for assisting us implementing population programs. We really want to request that you continue taking it personally as institutions so that you're able to address the pressing issues affecting our population. Maybe I can name some few who are our implementers, those who are here and those who are not here. Just a few of them. We've got CSA, Pathfinders, PSK Kenya, AFIDEP, SRHR Alliance, Faith to Action, DSW, IPAS, FHI 360, RHNK, and Maristops, among others. I may not have exhaustively mentioned all of them, but we want to sincerely, as NCBD, appreciate you. We also want to appreciate the young people and the adolescents. I know we are here because of you. And we want to say that even as we live here, kindly we want to continue that this message may continue being awareness being created on especially the numbers that are affecting our young people and adolescents. You've seen the issue of alcohol or drug and substance abuse. You've seen issues of teenage pregnancy. We've seen issues of HIV and AIDS. And in your spaces, the various spaces that you've mentioned, and I think Nicole and the other gentleman from UNFP, you actually mentioned the various platforms which are there, the spaces which are there, not our traditional ones of having meetings in such conferences. Kindly let us pass this message so that all of us knows the position and we see how to improve on them. Another institution I would want to appreciate is the government institutions. And I would want to start with Kenya Bureau of Statistics. Today we are talking about data. And the only official institution or agency that is not to provide official data is KNBS. You've got a mammoth or a big responsibility to assist us with data that will enable us to make decisions based on facts. Even when you do our programming, we must base our programs on facts. So you've got a huge responsibility, and we do believe you can live to our expectations. We've got other institutions, Ministry of Education, we've got Health, State Department for Health, Medical Services, among others. We want to really appreciate, and also the State Department for Economic Planning, where NCBD is domiciled, because we do planning and we plan for people. We don't plan for anything else. We plan for people because we want to address people-related issues. We want to appreciate the media who are here. I'm seeing the Citizen, I'm seeing the KTN, among others who are not here. Yeah, you've got a huge responsibility. First, you have assisted us to cover and Sambasa message tonight because we are celebrating World Population Day. So we want to request that even as you cover this, kindly let it not stop here. Let's continue creating awareness in the forums you are going to get. So we are requesting you to be our champions so that this message will not be within the walls of this room, that it will go out and more people will know about our population issues. Let me also appreciate the hotel. I know, they have hosted us. I think it's an humble environment. That's why we're able to dissect whatever we are discussing. And lastly, let me appreciate the Council, National Council for Population and Development. I know you decided to reschedule this event to today because of the many challenges that were there. And despite all, today we are able to have this meeting. We want to say thank you. Thank you. And all of us, when we go, let's become ambassadors of disseminating this information. Thank you very much.
Thank you. We're just finalizing. So what will happen is we'll have prayer and then national anthem. I have one announcement to make. Lunch will be served at the poolside, but you will need to pick a meal card before you go for lunch. And we still have materials outside, booklets and literature that you can take home. So please get a chance to interact with that. So for now, I will call one Jay-Z to come and pray for us. Volunteer. Clap for him.
Okay, good afternoon. I hope you are good, eh? Yes. Gen Z, yeah, you will stand up for our word of prayer. You know, we are heading to our meals, eh? So you need to put a smile on your face as we welcome God. Yeah. Okay, bow. Kind and everlasting Master, we thank you for this opportunity. See, Daddy, we started this meeting with you, and we're ending with you. See, even as we're breaking, give us, Father, knowledge, Father, to understand above. Above all, Father, we invite you. Be with us, Father, as even we are breaking, continue being with us. Be with our meals. In Jesus' name, we pray, trusting and believing. Amen.
Okay, thank you. National anthem, please. Let's remain upstanding for the national anthem, and then we leave. We will have our guests leave first, and then the others will follow. So, national anthem, please.
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu.